Good morning, honourable members and our support staff, our guests. It is exactly 9 o'clock, so I think it's time for us to start our meeting. Let me start by welcoming everyone back from Easter. I hope you had a blessed time with your families. Let me also take this time to extend a warm welcome to the Portfolio Committee on Social Development that is joining us this morning, as well as Honourable Zungula from the ATM that is present. Welcome also to the Department of Social Development, MECs that are present, various representatives of the provinces that we've invited, the South African Human Rights Commission, as well as Ms. Lisa Vetten and our own department, the Department of Women, Youth and Persons with Disabilities. Can I ask Ms. Mdumizweni that we table the agenda for this morning, please? Yolanda?
Morning, Chair.
Morning, can you hear me?
Yes, audible, Chair. You want me to fly?
Yes, please. Mr. Mdumizweni, are you winning?
I'm winning. I'm gonna fly to shortly, Chair.
Okay, thank you. Thank you so much, Mr. Mdumizweni. Can you just scroll down? Honourable members, we've got a joint Portfolio Committee meeting this morning with the Portfolio Committee on Social Development. You are all welcome. We've got our opening and welcome tabling of the agenda and apologies, which we will do in a second. We will then have a presentation by the Department on Social Development on the implementation of the Sanitary Dignity Programme, the defunding of NGOs and NPOs, and the fight against gender-based violence. We will then take presentations by provinces on the same topics by the Eastern Cape, Western Cape, Gauteng, and Mpumalanga. We will then have inputs from the Department of Women, Youth and Persons with Disabilities, the South African Human Rights Commission, Ms. Lisa Vetten, the National Shelter Movement, and then we'll go to questions, comfort break, responses, and closure. Can I ask for a mover of our agenda for this morning, please? Any hands, honourable members?
Chairperson?
Yes,
Honourable Choker Adonis, I hereby move for the adoption of the agenda.
Thank you very much. Honourable Spies?
Hi, good morning, Chair. Good morning, colleagues. Chair, I second that for the movement of the adoption of the minutes.
Thank you so much. Can I then ask Ms. Mdumizweni and then also Ms. Ntsabo Lindy, if you can tell us who's in the meeting from the two various portfolio committees and also just table the apologies received, please. Over to the both of you.
Ms. Mdumizweni, can you start, please, from your side?
Okay, thanks, Chair. I will start with the apologies, Chair. The first apology we received from the Minister of the Department of Women, Youth and Persons with Disabilities, who's not able to join the meeting due to other commitments. The DM and the DG, they indicated that the DDG Shoki will be leading the delegation today, also received an apology from Honorable Shabangu, also received an apology from Honorable Litlape. So right now, Chair, according to the information that I have, we've got yourself, Honorable Kanyile, Honorable Spies, Honorable Khwekane. I will have to check other members. Honorable Kanyile, Honorable Shabangu is also part. I'm sorry. I thought no. I don't think this is Honorable Shabangu. Yeah, I think, Chair, for now we've got all those members. I hope that they will indicate if there are other members that are missing, but they keep on coming, Chair. So that's why I do not have a stable kind of a list. Thank you, Chairperson.
Chair, Honorable Tiamoto is in the platform. Thank you.
Thank you so much, Honourable Member, and welcome. Thank you so much, Ms. Mdumizweni. Can I hand over to Ms. Ntsabo? Lindy?
Good morning, Chairperson, from both committees and the officials in attendance and any stakeholders in today's meeting. Chair, I just want to first indicate the members that are in the platform thus far. I have member Abrahams, I have member Mchweni, I have member Tafeni, I have member Mare, Chair. Those are the members that are in the platform. I think they will keep on coming. Chair, I have two apologies. One is from the chairperson of this portfolio committee, social development, member Masango, who is unable to attend today's meeting due to prior commitments that she was unable to change. The second apology is from member Abrahams, who is in the platform chair. She indicated that she will excuse herself at 11 o'clock due to prior commitments she needs to attend to. Thank you very much, Chair.
Thank you so much. I see the hand of Luvuyo Shasha. Is that correct?
You are correct, Chair. Morning, Chair. My apologies. I did send an apology note to Dumezweni. The apology for the Minister of Social Development, who is at Lesotho, and the apology for the Deputy Minister, who is at KZN. Thank you.
Thank you so much, sir. Thank you so much for that. And thank you for the apologies that have been tabled. And hopefully we've accepted all of them. Honourable members, this morning is a very important meeting, as it is a continuation of the work that we are doing with regards to oversighting the implementation of the Sanitary Dignity Programme. We know, for example, that monies are allocated to provinces for this project, and it is often not spent. And when it is spent, it is delivery of these products are often erratic. And we have also established that in most instances, we are not reaching all of the beneficiaries that this program is intended for. Then with regards to, for example, the Twekwe case, I think it is again firmly put the spotlight on our nation's crisis as it pertains to gender-based violence. One of the lead departments in the fight against gender-based violence, as per the National Strategic Plan against gender-based violence, is, of course, the Department of Social Development. And I think also tied to the fight against gender-based violence and femicide is also the issue around the defunding of NGOs and NPOs. We know that these organizations provide vital services on behalf of the state. And as a principle, we as a portfolio committee have said that when organizations look after the most vulnerable children, the most vulnerable women and persons with disabilities, these organizations should not be subjected to budget cuts. But of course, this has not been the case. And so this morning, we will aim to probe all of these issues, both issues around GBV, about the implementation of the Sanitary Dignity Programme, and of course, the issues around defunding of NGOs and NPOs. So again, all honourable members, you are welcome. Thank you very much for joining us, all our guests, all our stakeholders, and all the observers, South Africans watching us live on the various platforms. I'm now going to hand over to the Department of Social Development as per our agenda. to start with their presentations. But also, please let us be mindful of the time. If you've been given 10 minutes or 15 minutes as per the agenda to make your presentations, please let us keep to those time slots. If it needs to, then you'll have to do some highlights in your presentations to keep within your time slots. But we do need to get through all of the presentations to enable honourable members to be able to participate and engage with the presentations. So may I hand over to the Social Development Department to start with your presentation? Thank you. Is it Mr. Kakaza? Please unmute. You are muted. Colleagues, it is only myself that I can't hear the presenter.
Good morning, Chairperson. Am I audible?
You are now audible. Please proceed.
Thank you very much. My name is Peter Nechpare, the Director General of the Department of Social Development. I'm with officials and from the department that are going to do three presentations on the three issues that has been raised. I must acknowledge that it's a very hectic, but we appreciate the oversight. We appreciate your concerns, and we appreciate that as part and parcel of our responsibility. We are going to do the presentation. The first presentation will be the ones that you just raised, which I will ask my colleague to do the presentation. I just want to check whether you have given me the hosting. Okay, let me just check. Thank you very much. Let me just load the presentation for you, and I will ask Desiree, Jason, to do the presentation on the behalf of the department, and then we will then take questions after this presentation. Thank you very much. Over to you, Desiree. Slideshow. Thank you very much, Jason. Okay, thanks very much.
Thanks, DG. Good morning, Honourable Chair and members. I will be presenting on the implementation of the Sanitary Dignity Programme within the social development sector. The presentation will cover a number of areas. Firstly, it is to brief the Portfolio Committee on Women, Youth and Persons with Disabilities. Just take it back on. CBW, you can just help me quickly. It's off. So I'll continue.
Okay.
So firstly, it is around the problem statement. So research has shown us that there is a lack of sanitary products, which results in young women and girls from poorer backgrounds missing out on school. Most Black families cannot afford sanitary products due to high unemployment levels, which is further exacerbated in rural communities. Young women in Africa have been reported to be absent for a minimum of 4 days per month, totaling up to 48 days in a year. Sanitary poverty affects the dignity, pride, and health and well-being of girls and is severely negative towards their well-being. Effective sanitary dignity is therefore vital for the health, education, well-being, and empowerment of girl children. The context and the role of the Department of Women, Youth and Persons with Disability is that the Department of Women and Youth and for Persons with Disabilities has been mandated to coordinate the implementation of the Sanitary Dignity Program in quintile 1, 2, and 3 schools through the equitable share, which is earmarked funding. They are the custodians to promote and advance gender equality and empowerment of women and girls.
I'm sorry to ask you to pause just for a second. We've lost your presentation, unfortunately. On my side, it is no longer displayed.
It's displayed. I think there's a problem on the system. I think the issue of hosting is a problem because your picture becomes bigger than the presentation. If you look at that, maybe then you should go off the screen. Maybe you will be able to go, yes, we go to the main screen. We have got the presentation, but we struggle, it's not moving.
Okay, let's proceed.
Yeah,
are you able to see the presentation? Are members able to see? Oh, there we go.
It's coming, it's coming.
All right, thank you. Please proceed. My apologies.
Okay, thanks very much. Over to you, Daisy. Okay. Can you continue?
Okay. So the purpose of the Sanitary Dignity Implementation Framework, it aims to ensure that indigent girls and women are assigned by government to address period poverty. The objective is to promote sanitary dignity to all women and girls, inclusive of women and girls with disabilities, to manage their menstruation in a knowledgeable, safe, and dignified manner. In addition, the Sanitary Dignity Implementation Framework outlines the adherence of norms and standards of sanitary dignity in the entire value chain. This slide, it just then depicts the strategic objectives in terms of that it is to support and address child poverty and deprivation. It enhances the educational performance of girls. There's a reduction in their absenteeism, as well as the research that social development has done in collaboration with the Department of Women, Youth and Persons with Disability. There's an improvement in the sexual hygiene and rights, and girl children are more aware of the SAHRC. And then also they are able to manage their menstruation in a hygienic and a dignified manner. The role of the Department of Social Development is that sanitary dignity implementation is divided between Department of Basic Education, who is responsible for 5 provinces, the Social Development Department, we are responsible for 4 provinces, through the equitable share, which is earmarked funding. Some of the challenges that we also have is that provinces have autonomy in how they are going to implement the Sanitary Dignity Program. The social sector also assists in the rollout through the Social Relief of Distress Program to ensure that when there are disasters in the country, there is sanitary dignity given to especially girls and women. Then also there is the rollout for females in places of safety in hospitals, correctional facilities, as well as to youth-headed households. The National Department of Social Development, we participate in the National Sanitary Dignity Task Team, where we also assist in the oversight of the program implementation. The overview of the Sanitary Dignity implementation is that it is rolled out to schools, your quintile 1, 2, and 3 schools, which is no fee paying schools. to special farm schools, to ensure that girl children perform as well as boy children and there is no interruption in the attendance of school. There's also the economic empowerment opportunity, which is embedded in the program to ensure that women, youth, and persons with disability, they participate in the procurement process, that is in the tendering of the rollout of the sanitary products, and they participate in the entire value chain in terms of the manufacturing and the distribution. And with this empowerment opportunity, it also ensures that there is a lessened dependency on the multinational companies that currently is making a huge amount of money out of menstrual health. The program is also certain benefits of the program is that there is the 0 VAT rating on sanitary products since 2019 up to date. The governance structures, the social development and other departments play a role in the various levels within the implementation of the program. There is different committees at provincial level. There is then the committee which is participated by the Department of Basic Education, Treasury, as well as Public Works. There's also the school-based task teams that coordinate the implementation to ensure that the right product is given at the right time and the right quantity adhered to the South African Bureau of Standards. In terms of the budgeting for 2024 to 2027, the plus sign indicates the increase in allocations. For the Eastern Cape, on the right-hand side, we've also outlined what are the things that is working well and where is some of the challenges. For the budget for this financial year is 44 million. Currently, they have spent 9 million, but to date, there is an increase. The province of the Eastern Cape have decided to do a 3-year contractual approach to the procurement because of the challenges in when the school financial year starts, then the delivery of sanitary products, there's a challenge in terms of ensuring that when school starts, that the girls then receive their products. They have appointed 4 women and youth as their service providers. 2 of the 6 service providers, 2 are male service providers. They are currently meeting with the disability sector because there's a challenge that they are not reaching the persons with disabilities to be part of the procurement processes. The program, in terms of where it's allocated under the social relief of distress. And this is a policy issue because the rollout is then not given to every child, but the rollout is then given to only the needy girl learners. Climate change has also affected the distribution, especially because of the structure of the Eastern Cape. Once there is floods in some area caused by rain, the infrastructure is weak, and the service providers cannot then reach all of the schools on time. Gauteng, the 2024-2025 budget allocation was 30 million. The province has received 129 million from the provincial treasury. They are currently busy with finalizing the procurement processes. In Mpumalanga, there is a budget of 22 million. They are also finalizing the procurement processes, and they've got a partnership, which is also very critical with Love Life and Soul City, looking at the implementation. Western Cape has got a budget of 11 million. They are prioritizing rural schools. They have extended the distribution, not only focusing on quintile 1, 2, and 3 schools, but they've also included quintile 4 and 5 schools. They are finalizing the bidding evaluation processes. In terms of the monitoring reports, Western Cape, they have managed to distribute to quintile 4 and 5 schools. They've also reached the targets, especially in farm schools and schools for children with disabilities. In the Eastern Cape, there is a challenge related to especially the water and sanitation areas, because there is the challenge around the infrastructure, and the backlog affects 2,083 schools. They have increased the targeting to primary schools because there's quite a number of girls who needs the products within the primary school sector. In Mpumalanga, they have then, at the time when we did the report, they have re-advertised the tender, and the tender process, which closed on the 4th of April. Gauteng then they've used other funds in the meantime to ensure that there is rollout to the most needed school girls in schools. They've also now finalized their tendering process. They use the Back to School campaign to ensure that they roll out on the 5,000 sanitary products. The benefits of the program and some of the partnerships is that since 2019, learners in quintile 1, 2, and 3 and special farm schools have benefited from the program. The Western Cape and KZN, which falls under the rollout of DBE, they've been exemplary in terms of how they've managed to roll out on the sanitary product program. The other benefit is that the sanitary products adhere to the South African standard of Bureau of Standards and ensures that the products are safe for girls to use and it is not harmful. Apart from the distribution of the sanitary products, there is also the integrated component whereby there is the sexual and reproductive health and rights, which is included in the curriculum of the program and also included in how the program is implemented. There is also the water supply, sanitation and hygiene measurement to look at how friendly some of the facilities within a school environment. And also there is partnerships with the development agencies like UNFPA and private sector, for example, Old Mutual in the Eastern Cape, and then there is also Dis-Chem in Western Cape, and then there is the other two that I mentioned earlier in terms of Love Life and Soul City. Menstruation cannot be addressed separately from the challenges that we are faced around teenage pregnancy, because it brings about the girls to understand about unwanted pregnancies as well as menstrual health. There's also been very positive outcomes in there is a greater awareness from male teachers and male members of the school governing bodies, and boys have also learned about menstruation. Through the life orientation subjects within the schooling system and the comprehensive sexual education programs, girls have become more confident and better aware of their menstrual cycles and how to manage menstruation. Around the economic empowerment, women, youth-owned run SMMEs have benefited throughout the public procurement processes. The challenges that is experienced is that there is a delay in the procurement processes, there's insufficient planning, there is supply chain irregularities, and in the Eastern Cape and Gauteng has so far corrected some of these challenges that they've been experiencing. The budgets are not utilized optimally. Pricing is a challenge in terms of there is no standardization of pricing and the duration of the contracts. There's also policy concerns in terms of where the program is housed. In some provinces, it's under the social relief of distress. Other provinces, it is within the HIV and AIDS programs. Some provinces do not provide, there's not enough evidence-based information to adhere to monitoring, reporting, and oversight. There's also human resource challenges in having inadequate staffing, and there's also lack of involvement of the private sector. The other challenges is also that there is not sufficient functional provincial committee members in terms of representation from other departments, especially public works and COCTA and environmental affairs. The issue of infrastructure is a problem in rural schools, which affects the WASH element. But in terms of the benefits and the positive sides is that 2.7 million learners have been reached during the past financial year, but there needs to be an increase, especially in primary schools and girls with disabilities. There is contributions from other departments. For example, with NSFAS, there is an amount of 300 Rand per month for girls to buy their toiletries and menstrual products. And there's also money that's also been given to male learners through the NSFAS funding. Women in the correctional services, they receive the free sanitary products from the Department of Correctional Services, as well as where Department of DSD also provides sanitary products to the care and safety centers and living households. So some of the mitigation strategies, especially around the equitable share allocations, is that there should be also much more improved planning, budgeting, and forecasting. The procurement processes also to look at having more of a standardized pricing models. Targeting needs to be improved to avoid exclusion errors and also identify gaps in targeting, especially in your primary schooling. The human resources, this challenge, we should seek more partnerships to address the capacity constraints around the WASH elements. Departments of public works should be more incorporated, as well as COCTA, the Comprehensive Sexual Education Program. The DBE should review the curriculum. In terms of the implementation standardization, there should be better coordination between Department of Basic Education and DBE to ensure that there is an institutionalized approach to how the program can be standardized in all 9 provinces. On the M&E, monitoring and reporting, they should also review the targets and review the capacity building intervention aspects. There should be more impact assessments done to look at what is the change and the impact the program is bringing about, because it is a large-scale intervention. The concluding remarks is that there should be enhanced coordination between DSD and DBE to ensure standardization of implementation and rollout. The National Department of Social Development has enhanced the oversight role and will also be engaging more with the provinces, especially around the planning, budgeting, and targeting, as well as the value chain processes and the monitoring and reporting. Department of Women have undertaken a financial flow analysis to determine the extent of government's investment on the provision of sanitary dignity and further to address some of the gaps in the rollout of the program. DSD will be working closely, as we always have, with the Department of Women, Youth and Persons with Disabilities to increase the rollout to special schools and improve the number of women, youth and persons with disabilities to be able to be beneficiaries of the program, as well as within the procurement processes. National Department of Social Development, we are also seeking ways to enhance the monitoring side, whereby we will include the data sets into the National Integrated Social Protection Information Reporting System. The advocacy and information sessions about menstrual health, we will work much closely with DBE, especially around the comprehensive sexuality education to ensure that this aspect is addressed. We will be working closely as well with DBE in terms of the Indaba on menstrual health, which will be during the month of May. Then, in terms of the water supply, sanitation and hygiene assessments and verifications, which will be carried out in provinces to ensure that toilet facilities are hygienic and are conducive and girl-friendly. We will be engaging with DBE on the sanitation appropriate for education initiative to address the wash backlogs. Social development sector and Department of Women, Youth and Persons with Disability, we will be developing an evaluation plan and research agenda for the next 3 years. The recommendations is it is recommended that the Portfolio Committee notes the progress from the Department of Social Development related to the implementation of the Sanitary Dignity program in quintile 1, 2, and 3 schools in the selected 4 provinces. Thanks.
Thank you very much. I don't know whether a chairperson, we need to move to the next presentation quickly, because there are 3 presentations.
Yes, DG, you can just give us the highlights of the next 2 presentations, please, so that you still able to finish within your time slot. May I also just take this opportunity? I never greeted the Honourable Bridget Masango, the chairperson of the Portfolio Committee on Social Development. I was led to believe she's already in another meeting, but she's only leaving at 10. So welcome to the Honourable Masango. Over to you, DG. You've got 10 minutes for the next 2 presentations. Just give us the overviews, please.
10 minutes. Thank you very much, Honorable Chairperson and members. The next presentation was a little bit longer, but we will see what you need to do. But what we are providing to you is it's a report from the national point of view on the funding of the NPOs in the country. I will then request Noble Mfengu to give us the presentation. Over to you, Noble.
Thank you. Thank you, DG, and good morning to the chairperson and also the honorable members. I will try and be fast, as it has been indicated, it's a little bit long. So basically the purpose of the presentation is to present the report on the funding of the NPOs, specifically those that are looking after women, youth, and persons with disabilities, and those that are funded for VEP programs. So basically that is an outline, and as requested, I will just do an overview in terms of each section of the outline. So in terms of the contextual overview, I think we're all aware that in South Africa, the NPOs, they play a very vital role in serving social, economic, and also the environmental causes in communities. They contribute, on community empowerment, on building healthy communities, on employment creation, and all of those. So as NPOs deliver services in partnership with the department, so the department not usually funds the organizations, in the form of transfers, which are dispersed, to the NPOs on an annual basis through the signing of transfer contracts. So the following slides are going to present an overview in terms of funding, how is it allocated, and the number of NPOs that have been funded in the current financial year. So looking at the legislative overview, this is basically the DSD legislative mandate that I will not go into detail. For example, we administer Children's Act or Older Persons Act, the NPO Act, and all the other legislation that is relevant. So in terms of the registration of NPOs per sector, I think it's important to start from this as a sort of a point of reference. This slide is basically showing the registration of NPOs per sector, and maybe just to highlight that of all those different sectors that the organizations are registered under, mostly they are registered under social services, which constitutes about 39%, of all the NPOs. So of the 39% of these registered NPOs under the social services, the department, we fund over 7,000 of these NPOs that operate within the social development sector. And the transfers are made to organizations for the furtherance of their operations, and also consideration for funding is done through a predefined process of requests for proposals, because not all the NPOs that are registered on the database or on the on the system of social development are funded. So there is a predetermined process that we have to follow, which is this request for proposals. So this is basically in line with the PFMA. These are the Treasury regulations that highlight, that when you do the transfers, what are the, responsibilities of the accounting officer to ensure that, there is regular reporting procedures, there are internal and external audit requirements, regular monitoring, the scheduling of the visits, the review of performance, and all of that. So in terms of the breakdown of funding per each program, that is basically, the different budget programs for social development. I will not, go through all of them, but just to highlight that under Program 2, there's older persons and services to persons with disabilities. Under Program 3, you can see it's the families and child-related services. Program 4, that's where there is crime prevention, the victim empowerment, where gender-based violence and femicide also fall under. And Program 5 is more about your development and research and, community mobilization. So this slide is basically showing the breakdown of funding per program, as I've alluded in the previous slide, and is showing the allocations, per each of the programs. So this is basically the graphs that are, depicting those different allocations per program. With Program 2, your social welfare allocated 36% of the budget, the same as Program 3, and for Program 4, it's it's 19%, and Program 5 is 9%. So that is just also the summary of that. Then I will look in terms of the requirements to be considered for funding, because the funds that are given or allocated to the organizations, they are public funds, and therefore there has to be some form of eligibility requirements for the organizations to be considered. First and foremost is that the organizations, they must be registered in terms of the NPO Act, and they must be compliant with that legislation, because only being registered, it's not enough. They need to be compliant. Same applies for those which have got dual registration, that is, they are registered as NPOs and also as companies, so they also need to be compliant with the provisions of, the legislation that they have registered with, same as the cooperatives as well. In addition to being registered, it's also important that the organizations, they need to have a bank account in the name of the entity. They must have financial management and internal control systems because, it's in line with the PFMA. They need to comply with the funding requirements whereby, if they have to submit the reports on a quarterly basis, they have to do so. There should be no history of mismanagement of funds, as I've indicated that the funds are public funds, and therefore it's important for the organizations to use the funds for the intended purposes. So they also need to be registered or at least have a conditional registration in cases of services where the registration is a legislative requirement. For example, your children's legislation, there are certain requirements that they require from these organizations. So for those services or programs that do not have legislative requirement, the organizations are expected, to demonstrate, as it is, to demonstrate that they've got the necessary capability to render such services. And then in terms of, that predetermined process that I've talked about in terms of issuing a request for proposals, this is the process mapping that we follow. Even the provinces, are following this same procedure in that they call for proposals, they adjudicate, do the approvals and, the payments and the end-year reconciliation, which is also, part of the monitoring. So this is an overview in terms of the organizations that have been funded. And this basically shows the total number of those that have been recommended, which is 8,454, with 7,977 that had been paid up to so far. So this is basically the breakdown for each of the provinces. I would like to believe that the members maybe were able to go through the presentation. So now I'll be focusing on the funding of the NPOs specifically that are providing services to persons with disabilities, youth and women, and also, those that are rendering services under gender-based violence. So in terms of the overview, cognizance is taken that these services that are rendered to persons with disabilities, youth and women, they cut across all the programs as they must be mainstreamed in all the programs that are rendered by the department. So the following slides will focus on the funding for these services, as I've indicated, with GBV falling under your victim empowerment. So under older persons, what are these organizations funded for? These are just a few examples, as they do fund, even more than what is provided here. But in a nutshell, organizations, they are funded for community-based care, home-based care, residential, and also protection of older persons from abuse. And those are some of the examples of the activities that are being funded. Under services to persons with disabilities, the organizations, they are funded for remedial empowerment and development support, community-based rehabilitation programs, your socioeconomic empowerment, your residential and supported living facilities, etc. Under HIV and AIDS, organizations are funded for home and community-based support, psychosocial support services, material assistance, skills development, and all of that. Under VEP, which is your program 4, NPOs are funded for programs and services that are related to prevention, response, and aftercare for victims that are affected by crime and gender-based violence, with a specific focus on the most vulnerable, which include women, their children, and also the LGBTQIA plus community. Under victim empowerment services, NPOs are funded for providing care, support, social integration, and reunification. For shelters for victims, they're funded for the provision of short-term safe temporary accommodation, and also meeting the basic needs, as well as support, counseling, skills development, including the victims' rights and capacity building. I will not dwell much on Program 5, but that's where your youth development and your women development programs are being funded, like your youth clubs, skills development, outreach programs, and all of that. So the following slides are going to show province-specific breakdown, specifically to to these sectors that have been highlighted. So under older persons, this is basically province by province breakdown. For Eastern Cape, as you can see, for these services, your older persons with disabilities, HIV and AIDS, victim empowerment, youth and women, 922 of the organizations that were recommended were funded by the province. For Free State, from 353, 341 of those were funded, and there's a few that were not funded, about 12 of them, and the reasons are listed, like the outstanding compliance certificate. Others were awaiting the finalization of their agreements. For Gauteng, the total, it's 1,104. And out of those 1,053, they have signed the agreements, and 51 of those were still outstanding, as the payments were effected as and when the agreements were signed. I think we all know of what has also happened in the Gauteng with the delays in terms of funding of the organizations. For KwaZulu-Natal, 846, and 13 of those were not funded due to various reasons that are highlighted on the presentation. And then in terms of Limpopo, sorry. In terms of Limpopo, 511 of those were recommended for funding, and 56 were not yet funded due to the non-compliance and also other NPOs that were put under administration since the department wanted to do some investigations. And then in terms of Mpumalanga, 325 of those with 11 that were not funded. And the reasons are stated on the last column. For Northern Cape, 155 of those and 13 were not funded. And then for Northwest, 248 of those were recommended for funding. And under persons with disabilities, 2 of those, were not considered due to the compliance issues. Western Cape, there were no reported organizations that were not funded. So basically, this slide is showing the variance between the number of those NPOs that were paid and those that were not yet paid as at the time that this report was compiled. So this is basically showing the previous slide, and I'm sure that members might be wondering why Gauteng it's having such a longer, a line in terms of that graph. But it's because they are also funding quite a number of organizations as compared to the other provinces. So in terms of the summary, the reported details transfers for the third quarters of 2024 financial year, and 94% of the approved NPOs for funding were allocated their transfers in line with the contractual agreements that they signed with their respective provinces. And the remaining organizations that were not funded were due to varying reasons as outlined in the department, and the department acknowledges the limited funding as a result of allocations for DSD per province. However, no reports of a crisis in terms of funding the organizations were reported, and the provinces are often encouraged to process the payments so as to avoid the delays as these affect service delivery. So in overall, it is recommended that the committee takes note of the overall in terms of the NPOs that have been paid to date with the focus that was on the, those that are funded for youth, women, services to persons with disabilities, older persons, and the like. So for the remaining NPOs that are not funded, reasons they vary due to some of the administrative matters on the side of the NPOs. However, there are those that are associated with the specific provincial departments. For example, your Gauteng issue. In Limpopo, all the Program 5 projects are reported as not yet funded, which was a matter that was, addressed with the HOD as that impacts on youth and women's services. So for the rest of the provinces, no crisis was reported. However, should there be details of such, the department would investigate such with the relevant province. Thank you very much.
Thank you very much, Chairperson. That was presentation number 2, a detailed one. The last presentation is on our implementation of gender-based violence. Yes, I think this one. Yeah, we will gallop it quickly so that we are able to let's go back. No, it's not there.
And can we just ask Eastern Cape to get ready, because after DG is finished, we will take the presentation by provinces before we open for a round of questions and interactions. Thank you, DG.
Thank you very much. Sibusiso Malope will do the 10 minutes that is requested so that we indicate in terms of our role as national, in terms of our responsibility on the implementation of the NSP plan for the department. Over to you, sir.
Thank you, DG, and good morning, Chairperson, honorable members and colleagues. I'm going to take us through the DSD's contribution in the fight against gender-based violence and femicide. I will move quite quickly, Chair. There's the outline of the presentation, but I'm going to do quite a lot of jumping so that I don't take too much of the time, although I will try to highlight all the issues. So it's to brief the committee on the implementation of the National Strategic Plan on Gender-Based Violence and Femicide, Vision 2030, especially in the role of Department of Social Development. I'm not going to go into detail in terms of the context. We know the context that we are dealing with, what the President is declared as a pandemic in our country, which is gender-based violence affecting mainly children and women. Just to highlight that the department was also instrumental in the development of the National Strategic Plan on Gender-Based Violence. In fact, we were part of the first summit that was called by President in 2018, where the initial development of the strategy started. We also note that part of the bigger issue that we're dealing with here, it's actually institutional violence that we cannot shy away from as a country. But we also noting that it's very important that when we try to address GBV, we go the society approach in terms of knowing that issues of violence, they don't just start in communities, but they also starting in a home. As a country, as I've highlighted the issue of GBV, we've also, as the Department of Social Development, with a number of other stakeholders, identified, Chair, the areas that are problematic, if I can put it like that, in the country. And this was actually done in collaboration with our other stakeholders that we're sitting with at the JCPS cluster, as an example. So there are about 30 gender-based violence hotspots, gender-based violence and femicide hotspots in the country. And we try by all means that in all our interventions, we make sure that the 30 hotspots that are cutting across the country are covered in all our interventions. We're also not implementing alone. Of course, we're implementing with a number of stakeholders, and I've highlighted them there. I'm not going to name them one by one, but the key stakeholders here also is civil society organizations that the previous speaker spoke about as key partners and implementing partners that we are funding as a department. We're also playing a role then with other departments, including the Department of Women, Youth and Persons with Disabilities. Chair, in the 6 pillars of the National Strategic Plan on Gender-Based Violence, the department is actually contributing in all the pillars, although there's much more emphasis on certain pillars, and I'm going to go into that immediately. One of the key pillars that we're making a contribution as DSD is pillar 2, which talks to the issue of prevention and rebuilding of social cohesion. And in that pillar specifically, we start even at looking at what are the key issues to look at as a department in line with our mandate. And we're looking at the issue of prevention and protection. And there annually, at national and provincially, we develop what we call the 365 program of action on ending violence and against women and children. And this becomes a strategy that we follow throughout the year in terms of dealing with GBV. On a daily basis, on a monthly basis, we will have interventions that talks to this. We also have, Chair, in line with this, the RESIHA program, which talks to community, which is a community-based prevention and early intervention program. We've got social behavioral change programs that talks to issues of you only live once, which is your YOLO, CHOMI, and Gimoja. They talk to issues of substance abuse, but also involving young people in dealing with GBV. We also then are implementing what we call early intervention programs that are looking at the family itself, where we zoom into family. You will note that because our services are in the main run by social workers, so we're dealing with even issues of parent and caregiver focus, where we will engage parents on parenting, caregiving, but we're also looking at fatherhood, where we are dealing with issues of fathers, we're dealing with issues of values in families, as well as how do we deal with families in crisis. In this, we also have a legislation, our Children's Act, whereby we're also implementing the Child Protection Register. We're also contributing in the National Register for Sex Offenders. As a department, in Pillar 3, we make contribution on legislation. We've got currently legislation that is before Cabinet, the Victim Support Services Bill, that has been to Cabinet. The latest was October last year. We're going back to Cabinet soon. But this one is looking at also putting the victim in the center of the criminal justice system, where we literally say what is afforded to perpetrators of violence should be afforded to victims and prevent secondary victimization. We also, in terms of legislation, all have the Older Persons Amendment Bill that we're looking at. It will be looking at the register in the main as part of implementation. Chair, we then have our pillar 4, that is led by the Department of Social Development. We are the lead department in pillar 4. The pillar 4 specifically look at how do we strengthen existing response care and support services, which we all acknowledge that there are services. Some of them, they're lacking there and there. And the pillar is looking at how do we strengthen those services. We're looking at the issue of secondary victimization being eliminated as part of pillar 4. Victims that will feel that the department and the state, as well as civil society, is supportive during their time of ordeal of violence. But also the other element of this pillar is strengthening community and institutions that respond to issues of gender-based violence and femicide, ensuring that survivors and victims are supported. On pillar 4 specifically, Chair, what I want to highlight just in quick, it's to highlight that we also promote strengthening of statutory services that are provided by the department, specifically access to psychosocial services, talking to issues of trauma, raising awareness about availability of services, but also ensuring that there are therapeutic programs that are actually implemented for victims. But also you will see that we've included issues of children as they are affected in issues of GBV. Key to this as well is to ensure that there is aftercare services that is provided to victims and survivors of GBV. We've also highlighting key services that are provided nationally by the department. That is the National Emergency Response Team that will jump onto all cases that are there on GBV, but also even in situations where you will not ordinarily have a social worker to reach out in an immediate form. We've got the Gender-Based Violence Command Center, which is also another service that we are providing throughout the country, 24-hour service. I'll talk to it much more just in a few seconds. We've got the Kusaleka One-Stop Centers, Wide Door, and the shelter services that we are providing. We also then have aftercare services that is also looking at issues of rehabilitation, and this will also include issues of dealing with substance abuse as one of the drivers of GBV. Chair, on issues of shelters, I thought it's critical to also highlight how many shelters the department is funding across the country, covering all 9 provinces. 143 shelters are in our country, and they are funded by the department. We've got White Doors, Safe Spaces of Hope as a crisis response services of 72 hours or so. We've got about 206 of those. Then we've got Khuseleka One-Stop Center, where we are providing the service in a multidisciplinary manner with a number of stakeholders sitting in the same space, and those are implemented, or we've got the services in four provinces. Then I thought it's also key to cover the issue of bed capacity vis-a-vis the number of shelters that we have in the country. I can confirm, Chair, that we do have over 4,000 bed capacity to be able to accommodate women and children in situations of gender-based violence. We've also done an audit to look at are we having coverage of shelters throughout the country, and I'm going to indicate, Chair, that as we speak, we do have 47 districts in our country that are covered with shelters, and we have a gap that currently as national we're working on, as highlighted in that slide. So out of the 52 districts in our country, 47 of those are fully covered with shelters. Khuseleka One-Stop Center, I've just highlighted them. I thought it was just key to say, with those being there, which means we still have a gap of having this multidisciplinary service in Mpumalanga, in Free State, in Gauteng, as well as the other provinces that are remaining that I will not go into. We then, Chair, also as the department, we are generating statistics on I'll almost say on an hourly basis as a department, whereby we are guided even in our interventions in terms of where are the prevalences or the issues of GBV coming from. Hence, you will see there, I've highlighted statistics dating back from 2013, where when the department established the Gender-Based Violence Command Center for that year, we set at about 376 cases or calls that came into the command center. Today, as of February 2025, just from January to February, we're sitting at 23,908. During COVID, we had, if you combine all those numbers that are highlighted there on row number, I think it's row number 6, the way it says 2020, we received contacts with the community in terms of calls, SMSs, and police calls, over 184,000 persons that were reaching the command center with issues of GPV and non-GPV. So this is data that we're generating on a daily basis. It's a service that we're providing, run by social workers, 24/7. Chair, also key to highlight, there are also services that we are providing, obviously in collaboration or integrated with other departments. And that will include, for example, the 16 days of activism on no violence against women and children annually that we implement. We facilitate GBV dialogues with traditional leaders, which we call village to village. We've got social behavioral change programs with men and boys, which include what we call positive role model, whereby we encourage men in their local communities to be positive role model to boys. We've got everyday hero programs that is looking at a number of episodes that we are dealing with. For example, child abuse, neglect, and exploitation. And we also have human trafficking awareness, a program. I'm not going to highlight all of them. Those are part of the Pillar 2. And then Pillar 3, we've got the National Emergency Response, which I've covered. Then there's Pillar 3, we've got the shelters, as well as the White Doors, the Khuselekas, and the aftercare services. I'm going to move quite fast, Chair. In terms of our challenges, which I think it's key to highlight, is the lack of capacity in relation to GPV. This capacity is not only talking to workforce, but it also talks to expertise of persons that are able to deal with cases of GPV. Hence, we are actually ongoingly capacitating even our CSOs. We've got also a challenge in terms of dedicated social workers that are dealing with GPV, although the department has actually deployed across all 9 provinces as far back as 2019, about 200 social workers that were dealing with GPV, which I know that provinces continue to sustain those and even increase the numbers. We then also looking at the challenges, we've also forged partnerships in terms of dealing with some of the challenges whereby we'll approach a number of stakeholders. For example, we've got your health and welfare sector in terms of ensuring that we capacitate our foot soldiers on the grounds. We've also put the issue of GPV on an agenda and as a pending agenda in the departmental structures, such as your MINMEC, HSDS, and our provincial forums. So this is a part of the key issues that we had to look at. We have the issue of GPV in our APP as a key matter that is standing, and there we are actually ensuring that we implement monitoring in the services that is provided, but we're also looking at our data generation, but also direct service of GPV Command Center to say we need to ensure that we increase access in terms of even persons with disabilities. Going to recommendation, Chair, is just to say it's critical for the committee to take note of the participation of DSD, national, as well as provinces in the implementation of the National Strategic Plan on Gender-Based Violence and Femicide. Thank you. Thanks, Chair. Thanks, DG.
Thank you very much, Susie. So we gallop through Chairperson and Honorable Chair and Honorable Members. These are the three presentations that we have. I think members have got the presentation. We just ran through everything quickly.
Thank you so much.
Thank you very much, Honorable Chair.
Thank you so much, DG, for you and your team for those presentations. We are now going to take the provinces to give their inputs as well. So please do stay with us, because after we've taken the presentations by the 4 provinces, we will open for questions and interactions. So can we take the provinces in the following order? Eastern Cape, followed by Gauteng, followed by Mpumalanga and the Western Cape. And also we do have the presentations, they were circulated. So if we can just stick to the 10 and 15 minutes that were given, or 10 to 15 minutes that were given to the provinces, please. Over to you.
Thank you. Thank you, Chair. This is Eastern Cape MEC for Social Development. My name is Bukiwe Fanta.
Welcome.
Let me express my sincere gratitude for the opportunity to address this important portfolio committee meeting focused on women, youth, and persons with disabilities. Honorable Chairperson, honorable members, I need to acknowledge that we're at a very somber moment in our province. As many of you are aware of the gender-based violence that continues to rise, deeply affecting our women and children, especially in areas of Matatiele, as we indicated, where the pain of recent incidents is still fresh. In particular, the tragic case of Kwekwe has shaken our collective conscience. Yet, it is in the midst of such sorrow, we witness something powerful, the unity of purpose shown by the community across the country in response. People stood together, spoke out, and support one another. I want to take this moment to commend that unity. It is a reminder that when we are together with a common purpose, we can begin to turn our pain into action and our grief into advocacy. Honorable Chairperson, honorable members, the report we are to table here today is not merely a compilation of data. It is a statement to our shared commitment to uplifting our communities, in encapsulating the hard work and dedication of countless individuals striving for social change. To this end, the department has introduced a multi-year funding for NPOs, which represent a transformative approach to funding. Traditionally, many NPOs operate in an annual subsidy, which can lead to instability and uncertainty. By shifting to multi-year funding model, we aim to provide a more reliable financial foundation for these organizations. They are established a clear payment schedule for multi-year transfers so that NPOs can better manage their cash flow, reducing their financial strain that often accompanies delayed payments. This table allows organizations to plan their budgets and allocate resources more effectively. The Center Dignity Wealth Program is a vital initiative designed to support young girls, especially those from disadvantaged backgrounds, by removing barriers of education caused by lack of access to menstrual hygiene products. While implementing this, which is not without challenges, significant strides are being made to refine the program and address current inefficiencies. Ongoing efforts focus on improving distribution, ensuring consistent supply, and strengthening the monitoring and enhance the overall impact and reach of the initiative. As I conclude, Honourable Member, and Honourable Chairperson, today's dialogue is not just about oversight, it's about shared accountability and purpose. I am hopeful that through our collective effort, we can drive real change that is felt on the ground. I thank you for the opportunity given to me to address the committee. I look forward to engaging the open and discussion dialogue. Through you, Chair, if I can allow and hand over to the HOD to lead us in our presentation as a province. Enkosi kakhulu.
Enkosi kakhulu, MEC. Over to the presenter.
Thank you very much, Honorable Chairperson. Good morning, Chairperson, honorable members of the joint session, all the MECs, the Minister, and my colleagues in provincial and national government. I'm trying to load my presentation.
Mr. Mdumizweni, can you assist?
I'm used to Teams now.
Okay, no, it seems we're winning.
Oh, thank you.
Thank you very much, Chairperson. My name is Mzimkhulu Machemba. Am I audible, Chairperson? My name is Mzimkhulu.
Yes, you are. Thank you.
My name is Mzimkhulu Machemba, the head of Department for Social Development in the Eastern Cape. I'm going to go to the pertinent areas, Chairperson. We confirm the issues raised by the National Department with respect to the Eastern Cape on all the presentations that were made, Chairperson. And so we will not spend time on those areas. We will even not spend time on definitions and explanations of the program, because the programs have been dealt with, Chairperson. On funding allocation on gender-based violence, for 24-25, 158 organizations were funded to the tune of 39,158,000. And this 158 is outlined here: one-stop center, 13 safe homes, 132 white door centers, 8 mentorship programs, 1 advice center, and 3 NPOs that are subsidized. The NPA has 11 Tutuzela centers in the province. And whilst it is primarily the responsibility of the NPA to establish and fund, not DSD, DSD has a responsibility to ensure that policies and strategies on VP and gender-based violence are implemented. Because of the mandate in this regard, we've placed 2 social workers in each of the 11 Tutuzela care centers in the province for provision of response, care, support, and healing, Chairperson. And that is funding for VEP programs. Funding for women and allocation for women, Chairperson, the target is women and youthful women between the age of 18 and 65, who are encouraged to start income generation initiative using indigenous knowledge, skills to enhance income for sustenance at household level. And this contributes, of course, to socio-economic empowerment of women. These initiatives are encouraged to register as cooperatives and are supported through a seed funding. And the funding is given to registered women cooperatives that are operational, and it is mainly for material and equipment, including renovations operational sites. For 2024-25, Chairperson, we allocated 3 million for the women development programs, and this was given to 25 initiatives from the 6 districts and 2 metros. The activities that were funded include sewing, crop production, and poultry production. That is funding for allocated to women development. On youth, Chairperson, we must make sure that we implement programs that incorporate youth into the mainstream of the economy, targeting those between the ages of 18 and 35. Like the women development ones, we encourage them to start income generating initiatives using all their capabilities to enhance income for sustenance at household level and contribute socio-economically. And we also encourage them to register, and they are provided with seed funding as well. In 2024-25, we allocated 3 million, and it was allocated to 14 initiatives from the 6 districts and the two metros. Some of the activities that have been funded, including block making, vegetable and crop production, cleaning services, skills development, beading and sewing, charcoal manufacturing, poultry, upholstery, dance, and drama. And that is funding to youth activities. The funding allocated to persons with disabilities, Chairperson, because the white paper on the rights of persons with disabilities advocates for equality of persons with disabilities, removing discriminatory barriers, access and participation, and ensuring that universal design informs access, participation in the planning. We reach out and we implement programs that target people with disabilities. And we partner with non-profit organizations in the rendering of provision of residential facilities for persons with disabilities. We support 20 residential care facilities in 7 districts, reaching 812 beneficiaries. The second partnership area is provision of protective workshops for skills for people with disabilities. And the department aims to capacitate people with disabilities for sustainability and economic development by providing required skills. We support 26 protective workshops targeting 833 beneficiaries. The third area of partnership with NPOs in this regard, Chairperson, is the provision of community-based care services. We support these community-based rehabilitation intervention through community-based rehabilitation intervention programs and advocacy within the rights-based approach. We target 618 persons with disabilities and their families. The department supports 1,320 families caring for persons with disabilities to access a well-defined basket of social support services, Chairperson, and including provision of social support services. We continue with the allocation to people with disabilities. We allocated 32,555,000, and it is utilized as indicated below, Chairperson. 20.8 million for residential facilities, 2.3 million for protective workshops, 3.6 million for community-based rehabilitation projects, 5.6 for welfare organizations. We've also partnered with the Association for Persons with Disabilities, where it provides accessible transport to wheelchair users, a mobile repair service on call 24/7. They assist with repairing assistive devices as required, provision of a database of accessible accommodation for persons with disabilities. We have also facilitated the establishment of a provincial forum for persons with disabilities. We shall proceed to cascade that to district and local levels, Chairperson. Moving towards concluding, Chairperson, some of the challenges that I experience is insufficient funding. The cooperatives, the NPOs, would request a specific amount for funding. Given the fact that the demand is huge, we are never able to fund it 100%. We try as much as possible to stretch the rand because the budget, Chairperson, has not really been increasing over the number of years. Limited number of victims opting to go to alternative care accommodation. People prefer to stay at home. Their families prefer them to stay at home. But in as much as it is policy of social development to encourage that families take care of their people, where it is necessary for alternative accommodation, we will do that. But we do experience that people are reluctant for that. Shelters for victims, there's limited infrastructure. The Department of Public Works and Infrastructure is assisting, but there's usually delays. Even when we are allocated some of the old houses of Public Works, the renovations take time. Public Works runs out of money, and therefore social development has to gap in to assist in those renovations. Even if when we offer renovating a Public Works house, Chairperson, there's a process to follow, Chairperson, and also say that the program for persons with disabilities still lacks legislation that underpins its operations. We appreciate the fact that there are consultations taking place in this regard towards closing this gap, and we look forward to in the finalization of the process, Chairperson. We present the report for the consideration of the committee, Chairperson. On sanitary, the National Department covered the critical areas. The questionnaire that we were requested to populate, we populated and submitted, Chairperson, and we also confirmed the other areas reported by the National Department with respect to Eastern Cape. Thank you very much, Chairperson.
Thank you so much for that. We really appreciate the presentation. May I then ask that we go to the Gauteng presentation, and thank you very much, MEC, also for your remarks. We appreciate them. Can I ask if Gauteng is on the platform? Oh, I do see the MEC. Yes. Good morning, MEC.
Good morning, Chairperson, and good morning to members of the Portfolio Committee. Let me acknowledge all the public servants that are on call and led by the TG from Social Development. Chair, I won't dwell much. National has actually covered quite a lot of milestones with regards to the work that we do, especially on your sanitary packs and the NPOs. The letter said the NPOs that have been affected by the non-funding from the USA, and a majority of them we did submit to National because it's NPOs that may not necessarily funding, but it's NPOs that National had indicated that they will actually find means for them to be assisted. I will now hand over to Acting HOD, who will present. Can you load our presentation for Gauteng? Acting HOD will speak to the presentation. Thank you, Chair.
Thank you, MEC.
Good morning, Chairperson. Thanks, MEC, and greetings to all MECs and members of Parliament who are in the platform and colleagues. Chairperson, my name is Bongani Ngomane. I'm the Acting HOD for Social Development. We have prepared a presentation. I will request that it be loaded. And our presentation, Chair, it covers also our corridors, which I think it might be too much detail, but be it as it may, we'll reflect on it. It's you, Chair, who will indicate if it's necessary detail or not.
I think you can give us an overview if that is possible. And Mr. Mdumizweni, can you please assist with flighting the presentation? Ms. Silly, Mr. Mdumizweni.
Can you load acting HOD, maybe flight from your side? Can we be given hosting rights, please?
What's the name of the SOT?
Bongani Ngomane.
Okay, I will do.
Acting HOD, be ready? Chair.
Yes, Chair. I don't have rights yet to upload. Says host disable attendee from uploading.
I see you are the co-host.
I've given rights, Chair. Sorry, I'm sorry, Chair. I've given rights.
All right. Chair, you'll forgive us. We are used to Teams, so when it comes to Zoom, sometimes.
Who's exposed out in a PPT. There's no such chairperson. They are just PPTs. Why are we able to the share is there at the bottom, acting HOD. It's green in color.
Yes, I am working on it.
Manje PPT and niqedi 10 minutes yethu nina nisidlela isikhathi kube nenayekela mina nga present.
Yeah, and now you are eating into your 10 minutes, acting HOD.
They're eating into our 10 minutes, Chair, you know. They're going to give us some extra
You must crack
time.
the word for ABC. I can see.
They buy that too much. They buy that.
I'm struggling.
Chair, if I may, in the interest of time, is Ndumizeni not able to assist us so that we're able to reduce the time that we're cutting into for Gauteng?
Yes, I think that's either Mr. Mdumizweni flights it on his side, or we move to Mpumalanga and come back so that we give them time to prepare their presentation. Can I see whether the next province is ready to present?
Thank you, Chair. Yes, we are ready.
Okay. Then we'll come back to Gauteng, MEC, if that's okay with you. Then we'll come back to you in 10 minutes.
No problem, but meantime, we'll forward the presentation to the portfolio secretary.
Thank you so much, MEC. Okay, Ms. Patel. I see Ms. Patel, but she's muted. Okay, can we then go to the next province, please? If you are ready.
Thank you very much. Thank you very much, Chair. My humble greetings to the Honorable Chairperson of the Portfolio Committee, the honorable members of the portfolio, the MECs that are present, all the officials from different portfolios, and the delegates from provinces. My name is Honorable Katie Womweketsi. I'm the MEC of Social Development in Mpumalanga. Chair, thank you once more for this opportunity to brief this important committee on our work within the Mpumalanga Department of Social Development, particularly on the implementation of Sanitary Dignity Program and our efforts to support NPOs in the fight against the gender-based violence and femicide and the empowerment of women, youth, and persons with disability. Chair, the Sanitary Dignity Program remains a key government intervention aimed at restoring dignity to our girl children, ensuring that the menstrual health is not a barrier to education, participation, and opportunity. Chair, I think our presentation will give more flesh on this program of sanitary distribution. However, Chair, we want to mention as Mpumalanga that there are challenges in terms of this program. The first one, I think, under sustainable procurement and budgeting, we are actively working on developing local manufacturing partnership and encouraging women-led cooperatives to supply sanitary products, supporting both empowerment and sustainability. Chair, we recognize that our civil society partners are at the front line in the fight against GBV and delivering services to the most vulnerable. In this current financial year, Honorable Chair, the department funds NPOs across the Mpumalanga province in areas including victim empowerment, youth development, and disability services. Priority was given to the community-based organization in underserved areas, especially those led by women and youth. There are challenges that are remaining in that particular sector. It's the accountability of and compliance of the NPOs, which has led to delays in discernment, a lack of capacity in smaller rural organizations to meet reporting and government requirements, the increased demand for shelter services, psychosocial support, and community outreach in response to rising GBVF cases. Chair, in terms for us to address this, we have strengthened our monitoring and evaluation frameworks. We are rolling out capacity building workshops for smaller NPOs. We are continuously engaging with private sector to unlock additional support and resources. And also the triple pandemic of GBVF, poverty and youth unemployment continue to haunt our communities. Our department has aligned its work with the National Strategy Plan on GBVF and femicide, with interventions including victim empowerment centers across all districts, dedicated support to survivors of GBVF, including safe housing, legal referrals, and trauma counseling, economic empowerment programs for women, such as skills training and entrepreneurship funding. And also for youth, Chair, there are programs that you are embarking on as a department and also for persons with disability. Like Chair, having the youth, supporting the youth care centers and developing them, also supporting their programs. And the person with disability, we also fund disability forums and provide support in inclusive care facilities. Chair, as I conclude, and honorable members, we acknowledge that challenges are many, but we are committed to a whole of government, whole of society approach to ensure that the most vulnerable amongst us, our women, youth, and persons with disability are not left behind. Chair, we welcome your guidance as this oversight committee and your continued support as we strive for a just, caring, and inclusive Mpumalanga. I thank you very much, Chair. I will now request the Chief Director of the Social Welfare to give us the first presentation. Thank you very much, Chair.
Thank you so much, MEC. We appreciate that. And if we can just be mindful of time in terms of the presentations that you'll be presenting. But thank you very much for being here this morning. Can we hand over to the presenter?
Good morning, Honorable Chair and Honorable Members. My name is Gustav Wilson. I'm the Chief Director for Social Welfare Services. Chair, if we can have some assistance to upload the presentation, or if I can be provided with the opportunity to share the presentation, I will really appreciate it. I think I do have been provided with the opportunity to flag the presentation. I just want to go. Is the presentation visible, Chair?
Yes, we can see it. Thank you so much. Please.
Thank you very much, Chairperson. Good morning once again, honorable members, our honorable MECs, HODs, and our DG, colleagues at large. Honorable Chair, the purpose of this presentation is to provide to brief the Portfolio Committee on Women, Youth, and Persons with Disabilities on funding allocations by the Department of Social Development to NPOs working in the field of gender-based violence and femicide prevention, women, youth, and persons with disabilities. In terms of the victim empowerment program focusing on gender-based violence, prevention and services, support services, let me just, I think I just need to put it on slide mode base. Chairperson, the National Strategic Plan, as we have already heard from the presentation of our National department. It sets out to provide a cohesive and comprehensive response to GBVF crisis in the country by all sectors of the society. Chairperson, I think it has also been mentioned in terms of the pillars that is in the NSP, which I'm not going to repeat, just to indicate that pillar 2 and pillar 4 has been outlined, and that is where our department is fully responsible for pillar 4, and also we render in terms of the pillar 2 services with regard to prevention. When we look further, our department should ensure that the following interventions are embarked upon to deliver services to victims of gender-based violence and femicide, which is the strengthening the existing response, providing care and support to victims of crime and violence, eliminate secondary victimization, which means that they should not be further victimized in view of the fact that they've already been victimized as a victim of crime. We also have to provide support in access to psychosocial services, which we are doing, strengthen community and institutional support in the response to provide integrated care and support services to survivors of crime and violence. When we look at the funding of the NPOs, as already indicated by our national office in their presentation, Honorable Chairperson, in order to effectively implement this national strategic plan, the funding of organizations is critical. So we have to ensure that the NPOs are funded because they depend on services rendered in these organizations, so as to ensure that they do not go back to abusive relationships or even have to have further tragic outcomes, and that we avert this national crisis in our country. With regard to the 2024-2025 financial year, approval was granted to fund 23 victim empowerment programs in the province to the amount of 27,095,000 rand. And as being indicated, I'm not going to repeat what has been presented by our national office with regard to the processes that have been followed or are being followed to ensure that we fund NPOs that are compliant to the NPO Act and that they are being assessed through the processes that has been outlined. When we look at the table of funding that we have, our NPOs that we funded for the 2024-2025, and with your permission and indulgence, Honorable Chairperson, I'm not going to go into the whole list. I believe that the presentation has been provided to the honorable members and that they would have had access to see the number of NPOs that are being funded as well as the amounts that have been funded. We have 3 districts in the province, which is Eslanzeni District, Gertsebandi District, and those are the NPOs that are being funded, as well as in Kangala District. Those are the NPOs that are funded within those districts. In terms of the programs that we are rendering, Honorable Chairperson has already alluded to, Pillar 4, which is response, care, support, and healing. Just an overview of what we have provided within 2024-2025 financial year. A total of 2,533 victims received psychosocial services from the department and shelters funded by the department. A total of 70,771 persons were reached in the financial year 2024-2025 through the prevention services and awareness campaigns that were aimed at educating communities on the scourge of gender-based violence. We also had 3 victims of human trafficking within that financial year. However, we have had 133 suspected human trafficking victims that were referred by the Hawks or the SAPS for assessment, and that was due to the Operation Valam Godi that was run in the province. The department is then, as I've indicated earlier on, is funding the 23 NPOs rendering victim empowerment services to victims of gender-based violence. Going forward, with regard to the programs and services, social social work services. The department also rendered psychosocial support, as I've said, as well as prevention services, where we provide early intervention through awareness campaigns to communities to prevent the scourge of GBV. In terms of reintegration services and aftercare services, as being highlighted and emphasized by our national office in their presentation, we focus on reunification services also, where we'd like to see that there's healing and rebuilding of family connections, and where the person has been removed in terms of the violence that has happened. We also providing and ensuring that when there's reunification, that it is in a safe space, there's support that's been rendered, and also monitoring that should be done to ensure that acts like that are not occurring, or should it occur, that further support to be provided. In terms of programs rendered by the department focusing on women, Chair, just in a nutshell, as been indicated by our office, our national office, we do have women development and empowerment programs which focus on funding the NPOs, women NPOs as the department, as well as to ensure that they are capacitated. In terms of the life skills program, this is not only within program 5, but it cuts across to program 2 to 5, where we ensure that various programs and services are being rendered in terms of life skills. We focus on, as I've just alluded to, the gender-based violence and femicide prevention, the HIV and AIDS programs, and so forth. In terms of entrepreneurial and business skills, Honorable Chairperson, we're looking at microfinance schemes in an example of investment and savings, where we also ensure that women are involved and ensuring that they know how to venture into businesses and to establish new businesses. In terms of the livelihood strategies, we also have linked them to livelihood strategies where they continue to ensure that there's sustainability of their initiatives. In human capital, of course, Chair, we empower and educate them, and also make sure that they are self-sufficient, so that they can self-sustain, and further ensuring that they forging partnerships with various stakeholders that could ensure that they invest in their businesses. We have, as indicated in the presentation of our national office, we have 3 NPOs that we are funding in the province, and they are within the 3 districts. We have the Panorama Skills Development, Porter's House for Women, Kuya Fezeka Women Empowerment Project, and they are funded to the tune of about 1.8 million. And if we break it down equally, it is about 608,666. If we go to the youth, I'm not going to allude much to the youth programs, Honorable Chairperson, because I think that has been covered as well by our national office in their presentation, but we're focusing on a number of issues. We support the youth clubs that have been established, the youth community centers, where they are being assisted to with information on education and training. They are providing access to services where they can have where there's computers for typing of their CVs and business plans, etc., which they need. We also provide career counseling, career guidance workshops, life skills workshops, entrepreneur workshops, and basic computer literacy workshops. And we're also linking the youth with opportunities when they exit, for instance, in these courses, or when they are searching for job opportunities. We also fund these youth development centers, Honorable Chairperson, with regard to the equipment. Some look at infrastructure renovations or retailing, where there's a need for furniture, operational costs, and so forth. We also provide them with salaries and stipends. Honorable Chairperson, just to move on with the presentation, I'm not going to mention all the youth clubs as the youth development centers. As you can see, The amount that we fund them, it's an equal amount of 381,120. And again, we are funding them within, and they are spread throughout the province within the 3 districts, which is Etlhanzeni district, Geretsibandi district, Nkangala district, and that is our youth development centers. When it comes to programs rendered by the department focusing on persons with disabilities, again, Chairperson, it has been alluded to, we're looking at disability mainstreaming, our residential facilities for persons with disabilities, and protective workshops. We furthermore provide home-based care, where the aim is to ensure that persons with disabilities are taken care of within the community as far as possible. Also, with regard to stimulation centers, we provide services and ensure that the best possible conditions for our children with disabilities who cannot be cared for by their families during the day are being taken care of. And the purpose is to stimulate the children to ensure their development. Chairperson, one of the new extensions of our program within the province is the respite care program. This program has been piloted to care for families with children with a disability. This program is being run in the province in partnership with the Japan International Cooperation Agency, or JICA, in Etlhanzeni district. It is the goal to expand the program to other districts. The aim of respite care, Honorable Chairperson, is to provide relief to parents or families with a child or children with a disability. And the program is being steered by our department, the National Department of Social Development, and it was piloted in only 2 provinces, which is Mpumalanga province and Northern Cape province. Other services that we provide, Chairperson, to persons with disabilities is counseling to persons with disabilities, awareness campaigns. As we know that November is, we call it DRUM, or Disability Rights Awareness Month, and we are embarking upon a number of activities to raise awareness on disabilities. We also have capacity building on legislation pertaining to disability issues, and we ensure that there's forums that are being facilitated for persons with disabilities. Again, Chairperson, there's quite a number of NPOs that we are funding and that we have funded in the 2024-2025 financial year. We must indicate, Honorable Chairperson, that we have residential facilities that we are funding. We have protective workshops that we are funding within the 3 districts. We also have protective workshops with community outreach programs. This means that they're coming in during the day and they are going back home in the afternoon. We have also stimulation centers that we are funding, and the amounts that we are funding is indicated. Chairperson, it is recommended that a portfolio committee on women, youth, and persons with disabilities notes the presentation on funding allocations to NPOs working in the field of gender-based violence and femicide prevention, women, youth, and persons with disabilities. That brings me to the end of my presentation, Honorable Chairperson. I would just like to indicate that we also have submitted the questions, the questionnaire on the Sanitary Dignity Program to the honorable members, and we concur with what the honorable MEC is also in her introduction has alluded to, and we align ourselves to the presentation that has been done by the national office to that extent. Honorable Chairperson, I would like to thank you very much.
Thank you very much to Team Mpumalanga. We really appreciate you being with us this morning. I just want to ask all the provinces and MECs just to stay with us. We need to conclude now with Gauteng and Western Cape, and then we'll open for questions and inputs and comments after that. So may I hand back to you, MEC Mazibuko, and your acting HOD. And the last presentation will be the Western Cape before we start with our questions and answer session.
Thank you very much, Chair. Bongani, are you loading or is the committee loading?
Chair, I request the committee to assist because I'm struggling from my side. I hope they will be able this time to assist.
Mr. Mdumizweni, can we quickly assist? Ms. Silly, Mr. Mdumizweni. Okay, let me see. MEC Lond, are you with us?
Take Western Cape.
MEC Lond?
Chair, regrettable, the MEC is not present. I'm Zwandile, the Chief Director responsible for Community and Partnership Development, and I'm also the chairperson of the Provincial Sanitary Dignity Project. I'm not sure if you are giving us a go-ahead, Chair.
Yes, please utilize your 10 minutes. Sir. Thank you.
Thank you very much, Honorable Chair.
Mr. McDonald?
Just 1 second. The department is also represented by myself, the HOD, and then also the department is represented by our programs involved in GPV services. So the respective officials will do their presentation. Thank you very much, Honourable Chairperson.
Thank you, Mr. McDonald. If you can just direct them.
Yes, I will do so. Thank you.
Thank you. Over to you then, Mr. McDonald, to lead your team.
Thank you. I'll hand straight to Mr. Ewo. You can commence with the presentation. Thank you.
Thank you very much, HOD. My apologies. I was not aware that you are on the platform. So sorry about that. And then we have already extended the apology for the MEC. Chair, we have two presentations. One presentation will take the sanitary dignity program, and then the second presentation will deal with the GPV. I have the project manager with us, Ms. Mamusela, who will take us through the sanitary dignity project presentation. Over to you, Ms. Mamusela. Thank you.
Thank you, Mr. Ewu. Good morning, Chair, and good morning to everyone in attendance today. I'm Nomvuyo Mabusela, Program Manager for the SDP, which is the Sanitary Dignity Project. Before I start with my presentation, may I request the control so that I'm able to share from my end? Thank you.
Mr. Dumizweni, Ms. Silly, can you please assist us? We need to be ready to flight these presentations, otherwise we prolong the session.
Actually, I'm busy trying to make them co-hosts, but my Zoom is giving me some problems, but I'm busy with that, Chair.
Okay, please. And also be ready to flight Gauteng's presentation afterwards.
Nothing yet. I have not received any. Otherwise, are you able to flight it from your side? Because that could work as well. Nothing yet.
Mr. Dumizweni, are you winning?
I'm still busy, Chair.
Chair, may we speak to our presentation? It is available. It was circulated to members before the time.
Yes, so maybe we can just start by speaking to the presentations in the meantime, if that is possible. Ms. Silly and Ms. Abrams, please can you also try and intervene?
Thank you, Chair. If Mr. Dumizweni just makes me co-host, and I'll share Gauteng's presentation. Thank you.
Okay, now we're back to Gauteng. So my apologies for that. MEC Mazibuko, it looks like your team has got an opportunity now. My apologies to the Western Cape. HOD McDonald, we'll come back to you.
Thank you, Chair.
My apologies. Can we ask Gauteng to go through the presentation?
Yes, thanks a lot, Chair. We really appreciate the chance, and greetings once more to principals and colleagues on the call. Chair, in the interest of time, I really won't be long. I will just focus on certain critical slides, which I think it will be slide 3. Slide 3 basically reflects on the mandate of the department in respect of VEP and its related services. And it shows that we are trying very hard to respond to Pillar 2 and Pillar 4 of the National Strategy on GBV. Then if we can move to slide 5. Slide 5 shows the specific services that, Chair, you'll forgive my voice, I'm recovering from flu. Slide 5 shows the specific services that the department is rendering to its beneficiaries in the province, starting from the shelters, also shelters for LGBTQI community, the program for men's, the program for human trafficking, and the TCCs. If we can move to slide 10. Yes, slide 10 reflects on our program of action for this financial year, which is by and large fully funded, that we intend to roll out the 365 POA as directed by National and also consulted by with our critical stakeholders in the province. But we also intend to expand the GBV shelter services in the province, and to ensure that our NPOs are linked to the VFR services in the police stations. Also key, Chair, it's the issue of the capacity building for men's strategy, and to ensure that we develop a clear risk assessment tool for domestic violence and GBV in the province general. Chair, on the next slide, which is slide 11, it's the challenges that we are facing as a province and our responses to those challenges. Key, it's the issue of municipal compliance by NPOs. We find many NPOs being unfundable, because of their non-compliance in respect of the municipal bylaws. However, we engage with municipalities through IGR. We had a session last week with them. We also escalate necessary issues to SAHRC, hoping and pleading with SAHRC to ensure that there should be uniformity in municipalities, and the element of DDM should be implemented to ensure that the whole of government moves in one accord in respect of NPO compliance in the province. But also the MEC has reflected on the challenge that we are facing of USA withdrawing its funds. Some NPOs are knocking on our doors, which is a big challenge for us. However, NOXA is also assisting as it's linked to National. We are awaiting their guidance in respect of how we can assist these NPOs. Chair, I've spoken to issues of compliance, be it generally or on issues of TIP, it's still the same. We're also experiencing a high volume of victims of TIP in the province. especially those that are from foreign nationals, which makes sometimes communicating with them a challenge. But be it as it may, we are engaging with their embassies to try and give the necessary support. Chair, that is all I would want. I would like to draw the attention of the committee to. However, when it comes to funding, there is another presentation that we had prepared separate from this, which is written NPI budget presentation to portfolio committee. In the interest of time, Chair, I will speak on the presentation while my colleague is trying to project for us. Key, Chair, to mention on the issues of funding allocation, it's that Gauteng, the overall funding assessment or overview, it's that in Gauteng we've got 14 NPOs that we are funding, which are focusing on women's shelters. I'm on slide 2. Then, yes, thank you. Then also on social crime, we've got 19 NPOs that we are funding. And on VEP, we've got 12 NPOs. For shelters, we're spending around, or we have allocated around 19 million. Oh, it has disappeared again.
I think just continue talking.
Yes,
for
I
now.
will continue, Chair. I will round the figures off. On social crime, for those 19 NPOs, we have set aside 20 million. And for the VEP, which is 102 NPOs, we have set aside 125 million. For women program, we have one NPO, which is Provincial, focusing. We have set aside 7.7 million. And for welfare to work, which is basically a program that seeks to empower victims of abuse to be self-sufficient and not to rely on state security for survival. We have set aside 21, we are funding 21 NPOs at a 21 million budget. And for development centers, which is also focusing on skills and job creation for victims, we have 113 development centers that we are funding at 138 million. We also focus on youth. Currently, there is only one NPO at 11 million, but I was discussing with colleagues that we may have to change this figure and bring in more NPOs to share in the cake of 11 million, because this NPO is fairly new, and we are a bit concerned that we may need also to rope in other NPOs rather than depending on one new NPO. Also on skills development, we've got 7 NPOs and we are funding them at 31 million. For disability program, we've got 100 NPOs that we are focusing on, and we're funding them at 59 million. And for residential, which is by and large focusing on victims that need support, we've got 33 NPOs at 49 million. In fact, residential, it's more on older person and disability program. This is a general overview, Chair. I would like to stop there. If you drill it down deeper, then we'll take you to what we call corridors, like your Joburg, your Pretoria, your Citibank and Western. I don't think in the interest of time that detail will assist, but the information is with the committee to show what is allocated per corridor. But this is by and large a broader funding approach of Gauteng and allocation. Thank you, Chairperson.
Thank you so much to Gauteng. We appreciate your presentations. Can I hand over to the last presenter now, to HOD McDonald, just to lead your team in your 10 minutes before we take questions.
Thank you very much, Honourable Chairperson. I will, hopefully Ms. Mabusela is ready to go and has the ability to share the presentations. I'll hand straight over to her. Thanks.
Thank you, HOD. Thank you, Chair, once again, and good morning once again to everyone. So this presentation will focus on the implementation progress of the sanitary dignity in the Western Cape. So I will not stay a lot on most of these slides, as most of the information was shared earlier on by National DSD, and it is information that we confirm to be true in terms of what was reported on the Western Cape. However, I will highlight just a few key points. The project in the Western Cape is located under the sub-program 5.4, and this is the poverty alleviation and sustainable livelihoods. And this is because fundamentally, period poverty is as a result of poverty. So it made sense to us that the program would situate in a program that also aims to address issues of food insecurity and poverty. So we implement this program in partnership with the Western Cape Department of Education. They are the implementing partner. They are mostly active at district level, while the project is largely managed at provincial level. So within the project, we also have a Sanitary Dignity Committee, otherwise known as the PSDC. And this committee provides oversight on the role of sanitary dignity implementation. All PSDC representatives are nominated by the heads of department and have extended their support for the implementation of the Sanitary Dignity Project. So the roles and responsibilities of the PSDC are stipulated in the terms of reference, which is in alignment to the Sanitary Dignity Implementation Framework, otherwise known as the SDIF. So, Chair, I would like to speak briefly on this slide. This is the slide that gives an illustration on the composition of the PSDC in the Western Cape. You will see that all the transversal departments that are listed there are departments that participate quarterly in the PSDC meetings. And so the main purpose of the PSDC is to provide a platform for all Western Cape government departments, municipalities, and invited civil society organizations, as well as local government. And its main aim is to promote collaboration, coordination, and monitoring of the progress of the implementation of the SDP in the Western Cape. I think the most important thing that I would like to highlight in this regard, which is somewhat unique to the Western Cape, is the involvement and participation of civil society in this platform, which has added great value in terms of ensuring that civil society organizations are playing a role in actively implementing SDP in district and in communities are also privy to the strategies and responses that government is putting in place to ensure that period poverty is addressed in the Western Cape. So this is the SDP value chain elements. The NDSD speaker has spoken about this, so I will not stay long, but importantly to point out here, the girl learner is at the center of it all. And that is something that we ought to remember all the time. And then in terms of the procurement, it was mentioned in terms of how the processes of procurement also in the Western Cape, that there is a tender process that is led by our colleagues in the supply chain unit, and they are mostly responsible to ensure that they provide the technical support that is needed to ensure that the processes are followed. But also, as I mentioned, they are the lead in this regard. And so, again, I will not stay much on this slide because what I have listed here is already something that was mentioned earlier on. So in terms of distribution, what I would like to highlight here is that the project has ensured that there is a delivery schedule that's developed, shared between the service provider, the project, and the Western Cape Education Department, with clear delivery dates and the schools to deliver to, the number of pets to be delivered. And what we have also done, we have decided a while ago to do quarterly deliveries instead of monthly deliveries. This was to ensure that we promote cost-effective practices and also that girls have consistent access to pets, and as well as to reduce the administration burden on the project staff, as it had been the case when we were doing monthly deliveries. Then at school level, we have the district coordinators who are from the Western Cape Education Department, as I have mentioned, that they are implementing partner. And these district coordinators ensure that when the product is delivered at school, they are able to verify, number one, that it is the product that was approved, it has not expired, and also the number of boxes that have been delivered are equal to the number of boxes as per the delivery schedule, as well as the brand that is delivered. And then the distribution of pets to girls. One of the things that we have mastered in the Western Cape is ensuring that, number one, we promote continuous access to pets. That is, a girl doesn't have to queue every month for these pets. They can have a quarterly supply. But what we have done with that is to ensure that when we hand over 3 pets to a learner to manage for 3 months, it is coupled with education that emphasizes why we provide the support we provide as the province. This is to ensure that they stay in school. This is to ensure that they don't use unhygienic products when they are on periods, so that they are able to practice menstrual hygiene. And this is because we recognize that, as the NDSD speaker had said, that most of these learners come from very poor socioeconomic backgrounds. So it is highly likely that when they get pets, they will share with mom, they will share with their sisters, which we acknowledge. But at the same time, we make them aware why it is important to manage their supply so that they are able to school. So that linkage and that education that we provide with the distribution has added a lot of value. We have a no storage rule at schools. So in terms of storage, there's no storage that takes place after the product has been delivered to school. And the no storage rule is applied because we want to minimize theft, number one, but also to ensure that there is a significant reduction of time from the time when the product is delivered to the time when it actually lands on the girl's hand, because that we view as access once the learner has been able to receive the pad and they sign the register to acknowledge receipt. For us, it is also a means by which we monitor what is happening at school level. So again, here we do provide support in terms of the quintiles as per the SDIF. But what we have done in the Western Cape is to go beyond that and provide to quintile 4 and quintile 5. And this is because we recognize that there are pockets of poverty, even in the so-called affluent schools, where, for example, parents would take their children to those schools to access better quality of education, but also they go with some of these challenges. And in these schools, we focus only on those learners and not everyone. So currently in the Western Cape, that is in the 24-25 financial year and 25-26 financial year, we have the SDP across all 8 districts, 432 schools, equating to 145,594 girl learners. I will not stay on this slide, members of the committee and colleagues, because we have already shared the reports, and I hope you've been able to interact with the report and this data in terms of the age and also the number of girls we provide in each specific grade. And this is also, again, on the learners that we provide for in each specific grade and also the schools. What I can mention here that is important is that in terms of the schools, the project has in the past 2 years worked quite a lot in ensuring that there is a bridging of the gap between rural and urban schools. It was at 30%, and now in terms of rural, and we had metros at 70%. And this is not to say schools in the metros don't need support, but we recognize that schools in the rural areas, specifically the remote rural areas, are more desperate. And so to bridge the gap and to also respond to the disparities that exist, we have progressively increased support to rural schools. And currently the project provides support to 70% of rural schools and 30% of the metro schools. Also a unique dynamic that we find in the metros, which has also made us confident in making such a decision, is because a lot of the civil society organizations that provide sanitary dignity support in terms of pads are very active in the metros, and they also do provide to a number of schools which we are currently not supporting because of that they are able to get that support, something that you don't find in the remote rural schools. And then this is really just to specifically speak on what the SDP implementation has done in the Western Cape. I do acknowledge that NDSD did mention some of these nationally, but in terms of the Western Cape, we've seen a significant improvement in terms of contributing towards positive education outcomes. For example, most of the schools have reported that there's an improved rate in school attendance as a result of providing pads to learners. Positive health outcomes in terms of minimizing the risk of HIV transmission by providing pads to learners. We also contribute towards the reduction of the number of girls that would have entered in transactional relationships with older men in order to gain access to resources. And then reducing increased risk of unplanned pregnancies. Currently, we are aware that the Western Cape is also being impacted by the increase in the amount of unplanned pregnancies, particularly teenage pregnancy. And so the provision of pads to girl learners not only reduces the risk, but also reduces the burden on the healthcare system that would have been as a result of unplanned pregnancies. I've spoken about the reduction of avoidable infections by ensuring that girls have access to pads, or also minimize unhygienic sanitary practices during periods. Reducing an increase in the risk of GBV occurrence by providing these pads, the learners ensure that girls become less vulnerable to exploitative relationships characterized by violence, including sexual violence, which is something that had been mentioned quite a number of times here. In terms of age-appropriate sexuality education, which is mandatory in school, this has been mentioned already, so I will not spend time on it, but I can just highlight that this is something that we ensure happens at implementation level at school. In terms of positive outcomes for women, this is particularly with the awarding of the tenders. The Western Cape has ensured that it awards tenders to 100% women-owned companies from marginalized groups, and these companies and also companies of women with disabilities are prioritized to ensure their economic emancipation. This requirement is also made part of the bid specific as a minimum. As bid specification, as a minimum requirement. I did speak about the role of a supply chain here. And so in terms of compiling the bid specification, they also ensure that this is a part of the minimum requirements. Again, I will not stay in this slide except to highlight that, as you can see, in terms of the SDP financial flows, specifically on the budget that gets allocated to the Western Cape from inception right up to 25 to 27. And the reason we say 25 to 27 is because now we have decided to transition to a multi-year contract award. And so the service provider we have now awarded the tender to will be providing these services from 25 to year 2027. All of these companies are women-owned companies, except just at the start when we were still setting up and making sure that we put systems in place. I will not stay much on this slide because I've already spoken about the no storage rule, and also the issues around waste disposal have already been mentioned, which we confirm to be true for the Western Cape. Wash facilities. One of the unique things about the Western Cape is that all schools in the Western Cape have clean, flushable toilets. These are maintained regularly to ensure uninterrupted access and availability. However, what we know that we still need to maybe go in depth with is to ensure that these facilities not only have running water and are clean, but also they have, for example, they are disability inclusive, they have privacy and all of those things. But what I can mention for sure is that when it comes to wash facilities, the province has done very well to ensure that there is a conducive environment for girl learners to feel supported in terms of infrastructure that exists when they go through their periods. And then monitoring was also mentioned. We can confirm this to be true for the Western Cape. I think what I can highlight here, part of the monitoring that we do as the project, we do in collaboration with the Western Cape Department, and specifically in terms of providing technical support to the district coordinators, but also technical advisory support in terms of what monitoring instruments are effective, what works best, and so on. We do, however, know that we still need to find space and time where we are able to record some of the practices that we implement. Chair, this has been mentioned as well, and again, I would confirm it to be true that the Western Cape has, I think for the past year to be exact, has been recognized as having one of the best practice models in terms of the implementation of the SDP. And these are some of the areas in which the Western Cape has fared quite well in this area in terms of governance, a fully functional PSDC, and overall project management, quality of reporting, inclusion and meaningful participation of civil society, SDP linkages and integration with the Sustainable Livelihoods Program, and scaling up of SAHRC integration and implementation. I just want to touch quickly on the linkages with the Sustainable Livelihoods Program and the point that I had mentioned earlier on in terms of why SDP is situated specifically in that program. And so the Sustainable Livelihoods Program works with issues of food insecurity across the province. And fundamentally, what we know is that period poverty is not seen, or periods are not seen, but poverty is something that you can see. When someone is hungry, you can see that they are hungry in terms of their physical appearance and so on. But periods we often do not see. And so in very poor homes, the likelihood of buying a pad is significantly less when you compare it to buying bread. So when there is money, a household would rather spend that money on bread than buying a pad, which is why we know that where pads are not available, girls tend to use unhygienic methods during their period. So what we have done in the areas where we already know as a Sustainable Livelihood Program that there are pockets of poverty and there are schools that perhaps are not supported by the project, we have ensured that those schools are integrated in the project. And these are extremely remote rural areas. But what we have also done is to ensure that the parents of those learners are able to access food relief support services that are provided by the department through the Sustainable Livelihoods Program. And then in terms of the highlights here, we hold as the PSDC an annual capacity development seminar and workshops. And in this particular year of 24-25, the workshop was on the strengthening of SDP coordinating mechanisms at district level. And this was to ensure that all the efforts that are happening at district level are coordinated in such a way that they work towards a specific goal, but also that there is a coordinated response that would provide more support and also achieve greater impact. In terms of the challenges, the NDSD has mentioned these challenges, so I will not dwell on them, but I can confirm them to be true for the Western Cape. Chair and everyone in the committee, I have now come to the end of the presentation. I'd like to thank you once again for your time.
Thank you so much. Thank you, Mr. MacDonald. Please, is there one more presentation? We need to go to the questions and interactions.
Yes, I will ask my team to run through it very quickly and just touch on the highlights if that's in order with you, Honourable Chair.
Thank you so much. Please proceed.
Is it going to be Ms. Goosen and your team? Are you ready to present? Are you able to share your screens? Ms. Goosen, are you with us?
Yeah, I'm with you. I cannot share for a moment. The whole system cracked down. Maybe I can speak to it if you don't mind.
Yeah, maybe if you can just go through it quickly.
Yeah.
I think at a high level. Thanks, Ms.
Yeah.
Goosen.
Just in terms, I'm going to skip all the side issues. In terms of budget, DSD Western Cape have incrementally increased the budget over the past few years, and then there was between the last 2 years, a 8 million rand jump in terms of our budget allocation. The reason for that is that we had to onboard the USAID funding that fell away, and we also are expanding in terms of our shelter services and addressing salaries of social service professionals in this area. Without being able to display the different regions, I can say that our focus is on enhancing the services also in the rural areas. And for that purpose, we've increased services in the past 4 years in the rural areas with 5. We at this stage has 95 access points where a person can access the service across the province. We have 24 shelters, 25 shelters spread across the province, and 21 service organizations rendering services across the province, some with multiple offices. And then I'm just going to speak to the strengths and challenges. Our number of shelters does currently reflect the need for the shelters. And we've focused on the increase in the rural areas, and especially with the buildings supplied by Department of Infrastructure. All of those were in the rural areas. We increased our TCCs from 8 to 12 during the past 3 years, where we are co-rendering services. We use a differentiated budget model where we give a bit more funding to the rural areas than the urban areas due to the remoteness of the shelters and the cost related to that. And then in the new financial year, we are having a dedicated shelters for males subject to gender-based violence, members of the LGBTQIA+ community, and then also a new shelter that already started to be operational in the Overberg. Challenges was the cessation of the US aid that affected 2 NPO organizations. We had to step in and fund that services. Then the foreign nationals that are in our shelters that accommodate persons that are trafficked are blocking access to our local GBV, trafficking persons in the local to South Africa due to their long stay in the shelters. That is linked to prosecution of the perpetrator and having the person being able to testify. We are addressing this currently with Hawks and Home Affairs because it seems that it can take in excess of 3 to 5 years for prosecution, and we cannot provide accommodation services on conclusion on our professional services to a person in that period, and we have to draw on other basket of services within social development and other departments to focus on that. And then we only had 1 shelter that struggled now for a few years with capacity and management. And unfortunately, we had to terminate that contract in the last financial year. But as I said, we're already expanding already in that area again with a new shelter. And I'm not going to expand anymore. Thank you.
Thank you so much, Ms. Goosen. Let me take this opportunity to thank the DG of the Department of Social Development, all MECs present, all officials, and everyone that participated and gave us inputs and presentations. I'm going to allow now for members of Parliament to please engage with the presentations that we received. As I look for hands, I also want the Honourable, I want the Human Rights Commission, I believe it is Mr. Mdase, to also just make an input, a verbal input when I open the floor for honourable members. And also DDG Shoki Shabalala, if you also want to make an input now, I will allow both of you to speak. But I will take hands. So the first person will be the South African Human Rights Commission, Mr. Mdase, followed by DDG Shoki Shabalala, followed by Honourable Mabel, followed by Honourable Spies, followed by Honourable Chauke Adonis. Are there any additional hands? Followed by Honourable Jasmine Peterson, followed by Honourable Zungula. I did welcome you in the beginning, Honourable Member. Can I see if there are any further hands at this stage? Okay. I will start with asking Mr. Mdase if he wants to make an input, followed by DDG Shoki Shabalala, and then Honourable Mabel, Honourable Spies, Honourable Chauke Adonis, Honourable Peterson, Honourable Kanile, Honourable Zungula, in that order. Thank you.
Thank you very much, Chairperson.
Adabe, sorry, I'm sorry about that. Apologies. Please proceed.
Yeah, thank you very much, Chairperson, for the opportunity. As part of our observation as the South African Human Rights Commission, I think the best place to start would be to first emphasize the mandate of the South African Human Rights Commission, but not the entire mandate. But essentially what is relevant for the purpose of this engagement with the committee. The South African Human Rights Commission is, of course, mandated to monitor observance with the of human rights in South Africa. And Commissioner Quinnan, who has two important focal areas which are important for this engagement, which is the persons with disabilities and then the rights of children in South Africa, has been particularly concerned with the funding issues related to the NPOs and the sort of services that were provided by the NPOs. But also associated with that problem was the issue of funding related issues. And as part of our monitoring exercise in a number of provinces, we discovered that there were recurring issues that required some sort of attention. Even though our monitoring exercise is ongoing, we are discovering that these issues are recurring issues. And some of them are old issues that have came out as a result of the judgment in Free State, at least the 3 judgments that were talking about the issue of non-funding of NPOs. So the first issue that that the NPOs, at least in Gauteng and the Free State, complained about was the issue of outright cancellation of contract. They were saying that in relation to contract being cancelled, there's usually non-compliance with the administrative justice principles. And in other words, giving them adequate notice and giving them adequate reasons for why the contract is the contractor are being terminated. And those were some of the reasons that they shared. But also, what the rules of natural justice were being applied to ensure that there's adequate exchange of reasons and reasons for termination, but also reasons for why some of the NPOs have been not complying with their contract. And as a result of that, there's usually missing information in regards to whether there has been a process of sort that would have been implemented by the relevant department, the social development department, to ensure that there's compliance with rules of administrative justice. That's number one. Number two, there has been complaints, and at least I suppose this is a policy complaint, which relates to the difference in funding between government employees and the NPO employees. That has been one of the issues, and I suppose that's a policy issue that has not been addressed. And then the third factor that has been recurring as well is how much by way of funding should be the NPO's own contribution to funding its services. And then the last bit is then the issue of monitoring and evaluation. So given that the South African Human Rights Commission does monitoring and evaluation, which is basically around human rights monitoring and evaluation, it's not so much the implementation of the program itself, but also it's the human rights based sort of monitoring and evaluation. the commission has not been invited in any of these monitoring and evaluation mechanisms to the extent that they do exist. The view, which is the provisional view of the commission, is that there isn't any monitoring and evaluation mechanism built into the funding policy that allows for the commission to conduct some sort of monitoring, at least jointly with the departments in different provinces. Chairperson, those are the general observations, and some of them are informed by our previous provisional report, which is essentially not binding because it's not final as yet. It was just a monitoring report to see what has been happening. And we, of course, have not had an opportunity to meet with some of the government functionaries in different provinces, except Gauteng. We've had an opportunity to meet with the MEC and the team in Gauteng in relation to our monitoring. Our Gauteng Provincial Office has done some work with the department there, and we have received the presentation. Thank you very much, Chairperson. Those are just the 4 issues that we wanted to put forward. Thank you.
Thank you so much, Mr. Mdabe, and thank you for being present in our meeting. And hopefully the DG of Social Development took note of what you said, and hopefully after this meeting, we will see some engagements between yourself and the other MECs. DDG Shabalala, do you want to make any inputs before I give over to members?
Yes, Chairperson, and good morning, Chairperson and members of the Portfolio Committee, MECs present and HODs in our midst. In terms of the Sanitary Dignity Program, Chair, we are well covered, but I would like to make comments for the Portfolio Committee to note and probably enlist assistance. In terms of our observation, Chairperson, it would be desirable and essential if this program could be located under the same department across all the 9 provinces, as opposed to what is currently happening where we have it under either DSD or basic education. And I'm saying this, Chairperson, because this would make it easy to have it as a standing agenda item for one MINMEC. That will ensure uniformity as well as them being able to provide leadership and strategic direction so that we standardize a lot of things through this one MINMEC, if that is going to be something that can be acceded to. And the fact that it is located in 2 different departments does pose its own challenges at this point in time. Even if we were to push for it being a standing agenda item of MINMEC, it's going to end up in 2 MINMECs, and there'll be different directives offered from both MINMECs. So it is our request that if it's something that is in your purview, we would request that probably such recommendations be made. If not, we will also continue to play that advocacy role on our part as a department. Then there's another issue, Chair, that relates to the safe toilets. We appreciate the eradication of pit latrines, and we are asking again that the Portfolio Committee should assist us in following up with the Basic Department of Education as they clear the backlog as well. But that is appreciated because you begin to see how a child responsive or girl child those ablution facilities are becoming. On governance matters, Chairperson, we are recommending that the internal audit units of the provinces should actually put this matter on their radar for auditing purposes. We've started the process at national, and we've requested our auditor, internal auditor at national, to liaise with the 9 provinces so that this is a matter that gets well audited to ensure that the pet reaches the girl at the right time and that's the right product, quality product, all of those issues that the policy is advocating for. Then the last one, Chair, I wish to indicate that we've made strides in trying to assist with the economic aspect of the sanitary, particularly where we have managed to provide technical support to a lady. The company is called Lindiwe Pets. She managed to receive funding from NEF, and now her company is up and running from a manufacturing perspective. However, we wish to indicate that it hasn't been easy. I think we've walked this path with the lady for several years, and it requires us to be patient. We've requested her to bring on board the emerging organization so that she can provide that mentorship and guidance and take them through her own process, share lessons, and make sure that at the end of the day, they also learn and can fly on their own. The last one on funding, Chair, we are not a funding organization or department. However, we are noting the challenges. We wish to indicate that we are part of a committee at national level that is led by SAHRC as well as the Department of Health, which seeks to review the impact that the US Executive Directive has had on the organizations, considering that there's a twin relationship between GBV and HIV. And we will be looking at what are some of the recommendations we need to make that will probably have a positive impact where possible to the organizations that are affected. I would like to submit, Chair, and leave it at that. Thank you.
Thank you so much, DDG Shabalala. Can I hand over to Honorable Mabel?
Thank you very much, Honorable Chair. On sanitary dignity program, when you say in the Eastern Cape you were able to render service to rural areas, please be specific in which schools or areas, because Eastern Cape is very big. I think here there's a problem of the presentations not being detailed, and it gives us a problem. You cannot say I've rendered a service to certain provinces, but you don't specify in which areas in those provinces, because we have rural areas, we have really, it doesn't give any details. It doesn't give any details. All these presentations, they don't give details. That's my worry. And coming to an allocation of funds, when allocating funds, do you allocate them according to the identified provinces? If yes, what can be the reason of other provinces not being reached? On skills development, especially on disability, persons live with disabilities. You have stated provinces where you have rendered skills development. In which areas specifically, and how many rural areas have you reached? Please just be specific. On economic empowerment, how many disabled persons empowered economically in terms of procuring of sanitary towels specifically? We want those details. You are not detailed on this matter of economic empowerment. My last question, Chair, on NSFAS providing 300 rands for cosmetics and sanitary towels. Really, it is not enough. This money, it's not enough, especially in a state of economy we live in today. It's not enough. At the end of the day, it will force these children to go for a cheaper product, and that will, at the end of the day, cause them infections, and of which really they'll be forced to go to tuck shops and buy sanitary towels. And those products in the tuck shops are not proper products, are the products that will cause them diseases. That's my submission. That's my intake. That's my take, Honorable Chair. Thank you.
Thank you so much, Honourable Member. Can I give over to Honourable Spies?
Good morning, Chairperson. And good morning to colleagues, and allow me to convey my appreciation for the presentations that were done by the various department officials. Chairperson, I would like to pose the following questions. I first of all would like to commend the provinces that has really showed that they really seriously consider the programs under discussion as important, and to put everything possible in place to ensure that these programs are efficiently delivered to the vulnerable groups that need it so much. And I would like to start my first question by asking if whether the Department of Social Development nationally will consider developing a platform, Chair, to share best practices for the sanitary dignity program, specifically focusing on the Western Cape and also the KwaZulu-Natal regions, because they were the ones highlighted as being doing very well in terms of executing that program. And notwithstanding that other provinces are also trying their best. And also then in terms of best practices when it comes to the approach to timely payments to non-profit organizations. Then also I would like to find out, and I know that it's been touched on by the DDG and also by the Western Cape, but I would appreciate a bit more detailed information with regards to the fact that several of the non-governmental organizations that caters for women and youth, you obviously had delayed and short payments. And I would like to know the following: what is the progress that has been made in implementing the turnaround plans to address the short payments to NGOs, and how effective has these plans been? And the projected budget cuts to, and then my very next question, Chair, is particularly on monitoring, evaluation, and the impact of the sanitary dignity pack, because dignity program. My question in particular is to all provinces, because we have a lot of work that has been done, a lot of programs that has been presented, institutional structures, and a lot of processes. But my concern always with these are, are we delivering? Is there an impact? How is that impact monitored, and how is that used? And so I want the department to provide us with information on the frequency and the methodology of audits and monitoring conducted for the Dignity PAC program. And I also want to know how often audits are done and monitoring exercises are conducted, and what methods are used to assess the effectiveness of the programs and the impact. And how are these findings used to inform program improvements and adjustments? Then, Chair, I would like to particularly ask the Gauteng province a particularly very important few questions. And I have seen that there has been improvement, but I think it is important, and I've done a bit of research, and I think it's important that we learn from lessons in the past in order for us to improve and not and ensure that these incidents don't occur again. And my particular reference, Chair, is to the sanitary dignity fraud in Gauteng that occurred in the 2016-2017 financial year. We know that this report only surfaced in 2020 for various reasons that were cited that I'm not going into. But in a summary, that report, forensic report, details how officials within the Provincial Department of Social Development devised a scheme to circumvent procurement processes, and that unlawfully and unwillfully, enriched themselves and certain suppliers. And that was to the detriment of the public, Chair. And some of the questions I would like to ask in terms of this fraud report and to prevent similar incidents in the future is the following. I want to understand and know, and the department to share with us, what immediate actions have been taken against those implicated in that fraud report, and have any of the officials or individuals been suspended, dismissed, or charged? What measures has been taken to recover the misappropriated funds? Remember, we are talking here about over 100 million rand that was allocated, and only 24% of that money was distributed to, that amounts to about 248 schools in Gauteng. And one wants to know what has been done to recover that misappropriated funds. But then in terms of the internal controls and oversights, and I would like to understand what internal controls are in place to prevent such a large-scale fraud again. And if there were internal controls in place, Chair, what, why did that fail? Seriously, there needs to be a serious look into that. Then I want to know, often the department conducts also audits and monitoring and of the program that I've asked before, but in this particular report, I think it's important. And were there any warnings or red flags that were ignored or not addressed? Now, a lot has been said about procurement processes, and I want to know, was there what was the procurement process to select the non-profit organization that got the tender? Were there any irregularities or deviations from the standard procurement procedures? And I want to know from the department, will they ensure that future procurements are transparent, fair, and corruption-free? And the last question is, I do know that some of the officials that were implicated are still employed by government. And I want to understand what consequences have these officials faced, or individuals that didn't comply with procurement regulations or were engaged in alleged corrupt activities, and how will the department ensure that there's accountability and consequences for non-compliance? I would like to stop there, Chair. There's a number of questions, but being fair to my colleagues that I know I have a lot of questions, I want to stop there. I think lastly, I would like to suggest that there be a training and capacity building program provided for officials that ensures that there is no corruption, to prevent corruption and to ensure compliance with regulations, because maybe sometimes that is a problem. Maybe officials are not capacitated, and that's why things like that happen. Otherwise, one sees it as being willful. So thank you very much, Chair. Those are my questions. If I have a second bite, I have more, but for now, I will stop there. Thank you.
Thank you, Honourable Speaker. Yes, you will get a second bite after our next round of presentations. Honourable Chauke Adonis, our whip, over to you.
Thank you very much, Chairperson, for the opportunity, and greetings to all our MECs and heads of departments and representatives from the various provinces, and obviously members of the Portfolio Committee. Chairperson, if I may, I would request that I keep my video off because I am in transit currently, and for the bandwidth to hold, I'm requesting that I do have the privilege to keep my camera off.
Yes, no problem, Honourable Whip.
Thank you very much, Chairperson. Chairperson, I would like to appreciate all the presentations that have been made by both the Department of Social Development and also by the provinces. And I think there is quite a great appreciation in terms of the development and the progress that has been made in the various provinces, especially provinces such as the Eastern Cape and also Gauteng, where we have seen over the past few years there's been some deficiencies in terms of their operation and implementation of some of these programs, such as the Sanitary Dignity program, such as interventions that seek to address issues of inequality and disparities faced by persons with disabilities, youth, and women. I think, Chairperson, my first comment would start off, because I'll end with the department, would start off with the department in the Eastern Cape. I know in the Eastern Cape, there has been many concerns that have been raised by various sectors in terms of interventions that are to be made by social development in addressing systematic barriers and challenges that are faced by the most vulnerable. And one of them would be persons with disabilities. And I know that in the Eastern Cape, as part of their presentation, they did speak to these vulnerable groups. But one would want also an appreciation to see what exactly is the formula that is currently being utilized by the department in terms of its distribution of its resources and funds. It has been brought to the attention of ourselves as public representatives that there is an irregular channel of funding processes that currently are taking place within the Eastern Cape when it comes to funding programs, activities, and training of persons with disabilities. And what does that look like currently in terms of capacitating even those organizations that were not compliant? And I think this speaks to overall throughout the entire country. How do we ensure that all NPOs, DPOs, organizations, advocacy organizations, and structures that are not compliant, how are we working collaboratively with them to ensure that they are able to become compliant and are able to then assist the department and government in implementing its interventions and programs? Additionally, Chairperson, in terms of the Eastern Cape, in terms of the Sanitary Dignity program, one would want an overview of its impact in remote rural areas. We know that the Eastern Cape is quite a vast province, and we find that the rural areas are not places that are very much reachable. But how are we ensuring that those who are in rural areas, remote townships, are reachable and are able to access the Sanitary Dignity programs, not only being recipients of the products, but also of the intervention programs that are in place as part of the education that should be going out into communities? Additionally, how are we ensuring that we are working collaboratively in the Eastern Cape with the non-profit organizations that speak towards youth development, that speak to sexual orientation and education programs, so that we're able to sort of leverage off of their reach, but also off of some of the interventions and database that those organizations have? And I think we need to look at a more broader strategy in the Eastern Cape, seeing that that's where we are faced with high rates of gender-based violence, as well as the, with KZN. But Eastern Cape is one of our focus areas, Chairperson, as members of the Portfolio Committee know. We are faced with high rates of gender-based violence. We are faced with high rates of inequality, high rates of poverty in the province. And as part of social development's responsibility, not only through funding the non-profit organizations and also through the Sanitary Dignity programs and other interventions, one would want to see in the presentation what are some of the learned interventions that they are looking to implement, specifically speaking to the issues that they have identified as a province. And I think that's equally important for us to not have to come back in 5 years' time and still be addressing the same type of report, just so that we have a matrix that shows us where we are coming from, where we currently are, and the timeline of the interventions that the province seeks to implement, along with the various departments that the province seeks to work with in addressing some of the systematic barriers. And I think this also, Chairperson, in terms of its and I know it's not part of the report, but it's ECD transition. I think that was equally important for the department to have spoken to that, because those address youth development and persons with disabilities who are greatly affected. Chairperson, when it comes to the province of Gauteng, we know that there have been many issues raised about, the reduction of funding to nonprofit organizations. But I know that over the past few months, some of these irregularities have been addressed quite successfully. But and I think Honorable Spees did allude to the fact that there must be a template that speaks to some of the learned experiences and what are the interventions to ensure that we mitigate them going forward. And the department in the province as well, Chairperson, and I would like to perhaps get a response from the MEC and the team. What is the reach, the exact number of schools that are beneficiaries of the sanitary dignity program? Because we know that as part of our oversight, as part of our responsibility as members of the National Assembly, when we go into a constituency, you get a realization that there are some schools that are not beneficiaries or who have never been beneficiaries of the sanitary dignity program. And perhaps one would want an overview of how many schools are being serviced by the department, how many are still excluded, and what are some of the interventions that the department, through the MEC's office, seek to implement to address some of these systematic barriers, especially when we look at previously disadvantaged communities who are unable to become beneficiaries of such a crucial and integral program that is being implemented by the department. Additionally, in Gauteng, and I think this speaks, Chairperson, to Gauteng and the Eastern Cape, being very big, huge provinces, how are we ensuring that the distribution channel cuts across board? And I think this was mentioned by the department to ensure that there is economic development or opportunity, sharing of opportunity to women, youth, and persons with disabilities. Is this a mandate or a recommendation that is being met by the two large provinces? And I think this equally goes to all the other provinces as well. Because what we are finding, for example, Chairperson, when we had Limpopo Basic Education come and present to us as custodians of this particular sanitary dignity program, we came to a realization that there was only one service provider, the same as KZN, where there's one singular awarded service provider who is then given the responsibility to subcontract. Now, one would really want to have an appreciation to say, how are we ensuring that women are beneficiaries, youth are beneficiaries, persons with disabilities are beneficiaries, and how are we measuring whether we're able to meet these particular targets? Because I think as a social development, you have semi-responsibility in terms of making sure that in terms of the procurement set-aside policies are being implemented, especially when it speaks to such critical services that are being provided to communities. Chairperson, I think also just coming to the other provinces, and I think this would then just be an overall a view, would be the same sentiments regarding how are we ensuring that women, youth, and persons with disabilities are put onto the procurement database. And I know a lot of the time the excuse would be that we're not finding these businesses, but one would want to really have an appreciation, and maybe perhaps the department will let us know what is the collaboration with some of the institutions that are responsible for SMMEs, such as your small business, such as your labor, etc. And I think that's equally important for you to also have the ability to extract from their database and invite candidates who perhaps are meeting the necessary requirements to come and bid. And what is the bidding process? Is the bidding process dependent on each province, or is there a centralized bidding process that is undertaken? And what are the timelines that are set for all the provinces that are under social development in order for them to implement these programs? Chairperson, again on the sanitary dignity program, we have an appreciation that some provinces, depending which department is responsible, would have a cycle of 3 months, 6 months, or 12 months in terms of the delivery for sanitary dignity pads or products. as a supply. But one wants to really understand what is the cycle that is being implemented by social development in these respective provinces where social development is the custodian of this province. Are we supplying quarterly or annually, so that we can also have an overview and understanding? And I think, Chairperson, just looking at the plan or the strategy that is being applied by the Western Cape, one takes an appreciation where we say no storage policy. And I think that needs to be implemented across all board and across all the departments that are responsible or custodians of this program, because this will ensure that learners are receiving these sanitary dignity products in time without any interference from either educators, principals, SGB, and other stakeholders, ensuring that it goes directly from the delivery trucks into the hands of the learners who need these products the most. Lastly, Chairperson, one would want an overview in terms of the impact. Also, what is the 5-year intervention plan of the department in making sure that we're able to meet the demand, the growing demand, in terms of organizations, non-profit organizations across the country and the funding requirements, and also taking into consideration that the funding requirements are sort of limiting to non-profit organizations in terms of the proximity and their ability to implement their programs. I know some of the funding requirements only speak towards funding workers and not actually funding programs or devices and equipment that might be needed by organizations. What can the department perhaps put as a recommendation or as a intervention strategy to sort of remove some of the red tapes that limit the organization from fully having the ability to access funding that will enable them to to provide services that is an extension of what government is supposed to do, but whilst at the same time giving the department an ability to have an oversight on the implementation of those programs and seeing that the non-profit organizations or the organizations are actually responding to the critical issues that are raised by society and by communities, and having a monitoring and evaluation tool that allows for us to see if there is a greater need for more organizations in a particular sector, in a particular section, to be amplified, whether funding needs to be reallocated to particular sectors. And one has raised very great concerns in terms of the amount of funding and support that is given to non-profit organizations that seek to support the most vulnerable, which would be the elderly and persons with disabilities, with high budget cuts when it comes to those particular institutions. But additionally, seeing that department runs out of funding, what are some of the interventions that are put in place to assist these organizations with perhaps accessing external funding opportunities outside of the department, being lobbied by the department? Chairperson, I think that's where I'm going to leave it for now. Lastly would be, what are some of the department's plans in terms of utilizing or leveraging off of the digital era that we are currently in ensuring that both the organizations as beneficiaries of the grant and support can access them, but also have it as a monitoring and evaluation tool, and also what can be done by the department in terms of monitoring the implementation of the Sanitary Dignity Program, utilizing technology and innovation through the digital innovation era. Thank you very much, Chairperson. I will then take the opportunity once again later on to take a second bite. Thank you very much.
Thank you so much, Honourable Whip. Definitely, I will allow you that second bite after the final presentations. Honourable Peterson, it's your opportunity.
Thank you, Chairperson. Greetings to everybody on the platform. Chairperson, I just have like a few questions. Firstly, with regards to the Sanitary and Dignity Program, are there any plans to expand the program to include other age groups or vulnerable communities? For example, like homeless women? And then with the funding of the NGOs, NPOs, and GBVF. My question would be that the presentation indicates that the Gauteng province NPOs do not agree with the service level agreement. What were the reasons cited for not agreeing to the service level agreement? And then with the GBVF national strategic plan, specifically referring to Pillar 2, which is the prevention and rebuilding social cohesion. How is the department integrating GBVF prevention into schools and workplaces? What programs are in place to educate young people about healthy relationships, consent, and gender equality? And also, are life orientation or other school curricula being updated to address GBVF prevention more effectively? And then lastly, Chairperson, the challenges faced in the implementation of the NSP GBVF, specifically speaking to the LGBTQIA+, how many shelters in South Africa are equipped to provide inclusive and safe spaces for the LGBTQI+ individuals? Thank you.
Thank you so much, Honourable Peterson. Over to you, Honourable Kanile.
Good morning, Chairperson, and good morning to everyone in the meeting. Chairperson, we appreciate the presentations that we have received today. And I have a few questions that I'd like to pose from the presentations that we have received. Chair, I think the first question that I have, it is with regard to sanitary programs. There was a slide here that indicated the number of sanitary programs, sanitary that were delivered in schools. There were certain numbers that were given in the Western Cape, Eastern Cape, Mpumalanga, and Gauteng province. What I want to find out is what measure do Eastern Cape and Gauteng use to identify the beneficiaries? Because I am looking at, I think it's a column that speaks to number of beneficiaries reached in farm schools. Gauteng, there's a column where they indicated that 1. So I just want to find out that, does this mean in all the farm schools, they were only able to assist 1 beneficiary? And what measure did they use to identify that beneficiary, as well as the special schools? That would be the column on the left. I'm also noting that in Q4, Mpumalanga distributed 0 sanitary towels. What I want to find out, because I can see here that they've indicated that the tender that has been advertised, re-advertised, and it closed on the 4th of April. I want to find out, when was the tender re-advertised, number 1. Number 2, what is the current status of appointing the new service provider, considering that it was closed, the advertisement was closed on the 4th of April. While I'm still on Mpumalanga, Chairperson, I think I'm going to use this opportunity to bring in a few issues, or one issue that is happening in my constituency. I'm responsible for Likwa, which is in the Gauteng district. We have a couple that are running a baby rescue. They are currently housing, I think, about 5 or 6 children in their own home. They've been struggling to register their NPO, I think, as a house of safety from 2022. And this is a very big challenge for them. And we've tried to reach out to social development and standards, but we are not getting any breakthrough. And Chairperson, I feel that so the service that they are providing is very important, because they look after abandoned children. And when they are not properly registered, they are struggling to also get funding to can be able to run this place properly. As a result, because some of these kids, they go to school, they use their own transport to take them to school. When they don't have money, I normally see the husband walking the kids to school and fetching them later, which I feel is a little bit unfair, because they have their hearts in the right place, but it looks like they're not getting the necessary support. I want to find out, what can the MEC and the HOD be able to do to assist them to register their place properly. I want to come back to the issue of gender-based violence and femicide. I think, Chairperson, we are not doing justice if we are talking about GBVF and leaving out the issue of drugs, because we are aware that some of these incidents, they are caused by the substance abuse. We do have such reported cases. I think one would have wanted to also get an indication of what the Department of Social Development is doing to intervene on addressing the issue of drug substance, maybe get information also on a number of rehab centers that we are having in each district or in each province, and how many people have been rehabilitated, if they have relapsed, and also find out on their waiting list. Because I understand that sometimes you find young people that are ready to be rehabilitated, but the issue of the waiting list is always cited as a challenge. Maybe going forward, when we get a similar presentation, I would like to see that information being added. Chairperson, while I'm also on the issue of GBVF, I know that I've spoken to you yesterday about there is a reality TV program that is being flighted currently. I'm not sure in which channel it is being flighted on, but I think they call it Moja Love. I normally see it on social media. It is called Isengane Lengane. I have asked the chairperson yesterday to write the letter to the portfolio on communications to find out if we can find ways to can that production, because I do not see how it is educational to our young people, number one. Number two, I have noted that one of the guys there is very abusive. And I think it was a recent episode where I saw him carrying a plastic whip. He wanted to whip his wife and the mothers that were called by the wife to come and intervene. I want to find out if there's anything that has been done, maybe by the social development in terms of also intervening, raising their voice. Because if we have programs of that nature that are televised on a national platform, it means we are going to have a very serious problem to fight the scourge of gender-based violence, especially if we do not see them trying to come up with some interventions in terms of how the victims are supposed to empower themselves or to be empowered or to call out for help. But I just want to find out if there's anything that has been done by the social development, because we cannot really turn a blind eye. I'm sure all of us have seen it in one platform or the other. Chairperson, I want to go to Gauteng province. I have read on a number of platforms that in the 2024-25 financial period, I understand that there were 80 NPOs that were paid that did not have an SLA, while the ones that had SLA, I think it's about 84 of them, were not paid. Can the department please let us know how did they arrive at that decision? Chairperson, I think also that what I found to be lacking, it is detailed information from other provinces. One will want to know when it comes to the sanitary dignity program, I would want to know how many sanitary towels were distributed and in which school, and did they get the deserving beneficiaries? Because I noted, I think from Mpumalanga, they've just given us an amount that was spent, but we want to be able to follow the money. When they say, for instance, they've spent 4 million, we want to know where did that 4 million go? I think after this meeting, Chairperson, if they can, I'll appreciate it if in writing, they can send an email to your office that you can share with us. That indicates that in this district, this is the number of schools. I think the Western Cape did that. These are the number of schools that we have. These are the number of beneficiaries. And these are the number of beneficiaries that they have received the sanitary towels. Because when I'm also looking at Gauteng also indicated that they have distributed just above 5,000 sanitary towels. And you don't know how many beneficiaries are there in Gauteng, number one. Number two, you can't even tell if they have met their targets, if they have reached their target. Because if we're just going to be throwing around numbers, we are not doing justice to the exercise that we are embarking on. So I think after this meeting, Chairperson, I'll appreciate it if we can be finished with that information. And I am saying this because I had an incident where one of my colleagues requested sanitary towels from me. Apparently, it was needed in General Smuts. It's a school in Vereeniging. Luckily, because I have a foundation as well, we had some sanitary towels that were donated to the foundation. I took the sanitary towels to them. But I think it should be fair if we can get a detailed list for all provinces, actually, because we are doing an oversight for the other provinces that are looked after by the social development. The ones where the thing is responsible for them, Department of Education, I think will raise those questions with them. Also, there was the issue of a monitoring tool and evaluation that was raised. I don't think we're talking about that for the first time in this meeting, Chairperson. We need to really look into that if we want to do justice to the work that we are doing. The issue of sanitary dignity program, it's very important. When we say there are young people, young girls that are missing a minimum of 4 days of school when they're on their periods, we are talking about real people. We need to be mindful of that factor. And your problem statement, when you started this presentation, indicated that. So there is a problem, you are aware of it, and I think it's very important that the departments do justice to this exercise, because if they give us a detailed information, we'll also be able to see where there are challenges. I think Honorable Spies and Honorable Adoni spoke to that as well. But right now, we don't even know what are the challenges. We don't even know whether they are successes. We only see that the tenders, they have been re-advertised. And I want to go back to Mpumalanga. When you say the tender was re-advertised, can you please tell us the reason for the re-advertisement and when the first advert was actually closed before the re-advertisement? Because I just want to find out the reason, because now this causes the delay. That is why you are unable in Q4 to deliver not even a single pet. And I also want to know, I've indicated this, I want to know the number of beneficiaries in each and every province. Thank you, Chair.
Thank you so much, Honorable Kanile. Honorable Zungula.
Thank you, Chair. Greetings to yourself, the committee members, as well as everyone in the platform. I think, Chair, my first comment will be about the uniformity of the program to ensure that there is proper oversight and accountability of the program, because once there's uniformity, all 9 provinces will be doing the same thing, and the committee will be better placed to ensure accountability and oversight. But once the program is implemented, or the implementing agents in the different provinces are different departments, then it disempowers the committee from having a proper view of what is happening, with the understanding of wanting to improve the implementation of the program. The second issue, Chair, sometimes it is very disappointing to know there is a need in terms of girl children or girl learners needing the sanitary dignity packs, but because of maybe incompetence or having departments that are not caring, you find that there are funds that are returned to National Treasury, not because there is no need when it comes to children or girls, but the funds are returned to National Treasury because the departments are not doing their work in terms of ensuring that the money that has been budgeted is actually spent. Also, it is a missed opportunity to have a view of building capacity and developing suppliers that are specifically focused on the sanitary towels, because we do not want, it would be a missed opportunity, Chair, to have suppliers that are registered for various or general reasons. They go to, when they are given a contract by a department, they go to another manufacturer to buy and then distribute, instead of having a view of saying, let the department buy from a supplier that is focused on the production or manufacturing of these sanitary towels, because once that is a focus, then it also helps the country in the national crisis of unemployment, but will never solve the inequality, poverty, and unemployment problem if the suppliers that are used by the different provinces are just suppliers that also go to other companies to buy and then distribute. The other issue, Chair, it is deserving grassroots and community NGOs who are sidelined in favor of well-connected or international branches or branches of international NGOs. So I think, Chair, those are the few issues I would pose comments on. But coming to questions, the first one, Chair, is with Gauteng. I would want to understand whether the NGOs that are that they spoke about, can they give a profile of those NGOs? Because it also helps, Chair, given how Honorable Kanyile also stated that you have deserving NGOs who are already doing the work, but because they are not well connected, then they missed out. They get to be sidelined when it comes to these programs. So if we can get a profile of these NGOs that are utilized by Gauteng to have an understanding as to, are they branches of international NGOs? Are they local NGOs? Are they community grassroots NGOs who are working in the different communities? So that would be the first, in fact, the only question for Gauteng. Now, if I can move to the Eastern Cape, what is the justification of having the balance of the balance that is not yet spent? Why is that the balance? There's over 20 million that has not been spent on this program. And why is the period, the contract period, only 1 month? Because I can imagine the administrative and logistical hurdles of having a contract only for 1 month, whereas the need, especially for girl children, it's not that they only go into a cycle 1 month in a year, it is 12 months. So why is it that in this particular case, the contracting aspect of Eastern Cape, it is only 1 month? And based on the report, there is clearly a need when it comes to the students that have been provided in the different districts. The other issue is what then becomes the plan to fully utilize the balance that has not been spent to ensure that there is no girl child in the Eastern Cape that is deserving, that will go without sanitary towels. Now, the issue of the suppliers, the first question would be, are the suppliers only from the Eastern Cape, or the Eastern Cape province has also procured or utilized suppliers from outside of the Eastern Cape? And if yes, what is the rationale there? Are there no suppliers in the Eastern Cape that can deliver, produce, manufacture, and deliver these sanitary towels in the Eastern Cape to an extent whereby the department in the Eastern Cape will has gone to other provinces to source suppliers who can do that? What would be the rationale for using suppliers from outside of the Eastern Cape and sidelining suppliers from the province? Now, I've noticed here that there is very few suppliers there in the Eastern Cape that are distributing. And there is generally a problem in our country of the economy being concentrated in very few hands, even the government contracts being concentrated in few hands. What is the rationale for utilizing very few suppliers? And I've noted there's one supplier that is distributing, I think it is between 3 and 4 other districts. In those particular districts, are there no suppliers locally? Because part of the idea or the view would be to locally empower some of the suppliers in the different areas. It would be a missed opportunity if Eastern Cape had one supplier to distribute to the entire province. Again, it would be also a missed opportunity whereby you've got different districts in the Eastern Cape, but each district again has got only one supplier. Therefore, in our view, there should be a clear view of ensuring that the distribution outlets, which is the suppliers, they are diverse as possible to ensure that you get as many people to participate. Then you create opportunities, you create employment, and you assist when it comes to ensuring widespread access. So what is the rationale of using very few suppliers to distribute to the entire province, especially in light of that one supplier that is distributing in 3 or 4 districts in the Eastern Cape? And also on the question of suppliers, are the suppliers in the business of producing sanitary towels, or it is just suppliers who have open businesses and they tender in government for various and different projects? Because again, it speaks to another missed opportunity. Because once you have a company that is just delivering sanitary towels, their main focus is that when the department is procuring from such suppliers, then there's going to be the growth element, because those suppliers are not going to be buying the sanitary towels from other companies, maybe repackage them and then sell. There's going to be a view of opening even factories and other mechanisms to make sure that this is not only a buy, the suppliers will buy and then resell them back to the state. So I would want to understand whether the suppliers in the Eastern Cape, what is their profile? Is it suppliers that are sanitary towel specific, or it is just companies that do tendering with the state on different and various businesses, and that is their profile? And then the other issue is these suppliers that are used, do they have a product or a brand, or it is just a matter of you are going to ask company A will buy from Johnson & Johnson. After buying from Johnson & Johnson, then they will go and deliver. Do they actually have a brand? Then the last question, Chair, in the Eastern Cape, fortunately, I'm from the Eastern Cape, so I do know some of the suppliers in the space, and it is something that is troubling to say that a well-known supplier that has been in the space for a very long time, which is Ntombam Sanitary Towels, is not part of these particular suppliers that has been utilized. Whereas the people that are from the Eastern Cape, they know the work and the products that have been delivered by that particular supplier. So why is it that Ntombam Sanitary Towels is not part of these suppliers? Is there a specific reason maybe for that company to be sidelined? Because like I've stated, that it is a company that has got a proven track record in the Eastern Cape. And then when it comes to Ntombam Sanitary Towels, Chair, that particular company was also in a process of creating or forming, opening a factory in the Eastern Cape, Mdantsane, that would have helped when it comes to the problems of unemployment, of poverty in the Eastern Cape. And also, that particular company also provides additional services like menstrual coaching, which is critical to address stigmas and harmful stereotypes of menstruation. So I would want to understand the profile of these suppliers that are there in the Eastern Cape and why the particular sidelining of Ntombam, given the extensive work and the brand being known and the work that they've done in the Eastern Cape. Thank you, Chair.
Thank you very much, Honourable Member, for those contributions. I think I've been largely covered by all of the colleagues that spoke before me, but maybe I just want to ask a few questions, overarching questions to the DG of the Department of Social Development. With regards to abandoned children and support for NGOs and NPOs, what is the current thinking from the department in terms of baby savers? Why is the department not willing to support these, considering that they are a lifeline for vulnerable children? Then with regards to our fight against gender-based violence, we know that social workers are desperately needed, whether at police stations, whether at schools, whether at hospitals. So how many social workers trained by the state are currently still sitting at home? In other words, what happened with the plans to absorb these social workers into various key departments? Then with regards to the Twetwe case, the MEC for the Eastern Cape mentioned it in her introduction, but I was quite surprised that while this national crisis was unfolding, I found that DSD National was quite quiet with regards to this issue. And maybe the MEC can provide an update with regards to this case, because we heard at Parliament last week that the Department of Social Development has not been able to access the family and the child recently because the child was sick and they were denied access. So maybe if there was just an update in that regard. Then with regards to the 100% women-owned businesses with regards to the Western Cape, the 100% women-owned businesses delivering the Sanitary Dignity program, I think that is quite commendable. However, I saw a mention there of Access Medical, and our Honourable Whip spoke about this earlier, and we know that Access Medical is the sole service provider, a male-owned sole service provider in KZN, and I just wanted to check if that is the same service provider. Now, most of the provinces agreed with the sentiments raised by the National Department on Social Development with regards to the Sanitary Dignity program. And some of the highlights in DSD's presentation was the fact of inadequate planning and budgeting. We're not reaching all the intended learners, pricing challenges, insufficient empirical evidence, and also just the issues of the fund deficit. In other words, there's just not enough money to be able to successfully deliver on the Sanitary Dignity program. And I want to know, how do provinces intend dealing with this in order to ensure that they implement the SDP effectively? And yeah, I think also the uniformity is something that we will have to look at going forward. But lastly, I think my last question will go to MEC Mazibuko. I think Gauteng has been in the news for all the wrong reasons. First, it was the Esidimeni crisis, a life Esidimeni crisis. Of late, it's been the issue around the NGOs and the NPOs and the non-funding of those, and what seems to be a very hostile relationship in the province of Gauteng towards NGOs and NPOs that provide vital services on behalf of the state. I noted that at the end of January, Gauteng DSD was asked to provide to the Gauteng High Court a list of all NGOs that you are funding, and then also the NPOs and NGOs that you are not funding, and then reasons for those. And I believe that a full list was not provided to the court. Why was that the case? And maybe if you can just give us an indication currently of how many NGOs and NPOs that you funded before, whether it's shelters or organizations looking after women, youth, and persons with disabilities, are currently not being funded. And it can be for a variety of reasons, but how many of those are currently struggling to keep their doors open? If you can maybe give us that information for now. There's been a lot of questions, DG, so I'm going to hand back over to you, and from there we can take responses again in the way that the presentations followed. So we'll start with the Eastern Cape and take it from there. But back over to you, DG, and then to the provinces. Thank you so much.
Thank you very much, Honorable Chair. Yes, there have been a lot of questions. I will try to do justice, but in areas where we fall short, we might be able to provide some in writing so that we don't miss anyone. There's so many questions, but I think basically I will start with the HRC, the Human Rights Commission questions. that they've asked us in terms of the others are directed to Gauteng. But I think the main one was the issue of the taking from the Nawongo case, the 2009 Nawongo case, into the current funding of the NPO in the country. I think I should say that what we have found out, or what is the situation with the DSD and NPO funding, is that following in Nawongo case, the National Treasury did a review on the budget requirements for DSD, where they found out that we are underfunded by about 9.2 billion to be able to deal with the NPOs, and especially the challenges that the NPOs are addressing. So we continuously getting less funding, not necessarily less. I think as the values and the inflation goes up, there's a number of NPOs that emerges, lot of challenges that we face, and we don't have enough money to be able to deal with that. And that's because our proposal with the policies that we developed on the NPO funding was that we need to ensure that in areas where there are social ills, we need to fund the NPOs in those areas and also fund them accordingly. And one of the challenges that we find is the same issue that I think the Human Rights Commission raised about the salaries of social workers in the NPOs versus the ones that are in the department. We are dealing with that matter, and I think we were equalizing, but not so completely. We're looking at how we can deal with that. We included that as part of the funding criteria, that we'll be able to fund social workers, equal salaries, but you know that there are issues with regard to the funding of those. We are not at that level, and we are also looking at that matter. The other issues that they requested was the issue of the contribution of the, remember in the Nawongo case, one of the things that were there was that government subsidized the NPOs, which means that a certain amount of money, they must raise funds for themselves. But as time goes on, we are doing what we call program funding. We fund NPOs to render services, which means that they must completely do that. And we calculate the amount of money that we need to fund them. It's not enough, but we are able to fund them. And the services that we render are statutory, so we can't chop and change. Because if you chop this side on X and you want to fund Y, then you have got a problem that in that area you will not be able to deal with the issue that are related to that. That is the areas that deals with national. We are in the issue of the M&E. We were supposed to do the impact evaluation of the NPOs that we fund. We have got an M&E system. We developed now a new M&E system that we have. But I think in the provinces, when they do M&E, they go and do inspections, they go to the NPOs, and I think we will be able to include the commission as part and parcel of us as we go to those NPOs, so that you are not excluded, as alluded by the honorable member. We have got a mechanism, and we've got a format in terms of how we need to do the monitoring of NPOs. And I think provinces are doing well in terms of those. The delays in funding of NPOs, if I could lump it there, is both ourselves and the NPO themselves. The other areas where we find that there's delay from the national perspective is where NPOs do not comply. You might have seen, it's just that she didn't show. You will find that there are NPOs who don't comply to the NPO Act. Therefore, they are not compliant. So they will wait for that letter to come from national to provinces because they don't comply. They have to write to submit reports on periodically for that matter, and they will be able to then delay. One of the delays is also themselves the accounting process. If you are rendering services to children, you need to tell us how many children you have seen in those areas. So sometimes there's a little bit of a delay, but I think many provinces have done so. And we are, as national, facilitating that there is less learning, transpolations from different places to others. We, in the Western Cape, you have seen that they always have 100% funding of the NPOs because they're using a system. We adopted that system and we are in the process of rolling it out to all 9 provinces. Eastern Cape had a system, similar system, and you will see that it assists to ensure that we don't delay in the funding of NPOs. There are many questions which are specific to provinces, but I will only answer the questions that relate to national. But I will also ask the colleagues that I have got here to answer specific questions in relation to what they have. With regard to the issue of the sanitary towel issue, I will think, yes, I think there are some disjuncture, there are some things that are not. Remember, we are focusing on 4 provinces. The Department of Education is focusing on 5, which I think the issue of standardization and implementation of the program from one center, it will be the best way so that it can be standardized and we could be accountable accordingly and ensuring that we deal with all the issues accordingly. And I think it's something that we are looking at, that there's no others that are faster than others and people, the other ones use X and we use Y. And those are some of the things together with the Department of Women and Youth and Persons with Disability, we are looking at that we need to standardize and make sure that it is so that we can address the issues. There was another issue which I would just want to take before I give it to different colleagues of mine that are here. The issue of the delays. You can see that there's a lot of delay on the provincial budgets implementation. Some of the delays are issues that relate to compliance to National Treasury regulation. In 2019, there was Circular 21 of 2019 that prohibit us to render services. When we're rendering services, we are not supposed to use the NPOs to provide funding directly like that. We are supposed to use goods and services to procure and distribute because they felt that it's abused in other areas. So that has set us a little bit some few months behind because we need to do the tender and the tenders takes long. I think I'm talking on behalf of provinces now. It takes longer and it's something that we are looking at that I think once we get one, we have one for a longer period of time so that we are able to render services accordingly. There was an issue of the targeting the local economy, local people for distribution. I think it's a government plan which we focus on. The regulations also requires us to focus on 40% women and also providing economic transformation where we focus on the poor who are certified poor. One of the areas is the linking of grant beneficiary to sustainable livelihood, which also include that they must form businesses that must be funded by government so that they can be win out of social grants, and that also will assist us in them being part and parcel of the plan. The chairperson, you asked me about the issues of the baby saver that we have. What is the view? We had a serious debate in the portfolio committee for social development. For us to consider the baby savers as we amend our the Children's Act. There's a bill that now, but currently we haven't made a decision on that. It's still under debate because it's found that it contradicts other issues if we use baby savers, even if it's nicer. But we as a department, we are looking at it. We will, I think, make a decision, and we will notify the committee in terms of the decisions that the department make, because it's something that well managed could be better, but we haven't made such a decision as such. Can I then now take an opportunity to request a response from the first presentation, Desiree Jason, to answer some of the questions that was asked. Mostly the questions are to provinces, so we won't take long so that provinces are able to answer questions that are directly to provinces. Over to you, Jason.
Thanks, PG. The question related to NSFAS. As the National Department of Social Development, we do engage with NSFAS on a quarterly basis related to some of the social protection interventions. We will raise this as an agenda item in terms of the funding that they have of the 300 Rand per month. Then the other question, we work very closely with the National Department, with Department of Women, Youth and Persons with Disabilities as the lead coordinators for the sanitary dignity implementation. We do sit on the national task team, and one of the agenda items out of our planning meetings that we had was that we are going to review the monitoring, evaluation, and reporting framework during this financial year to ensure that there is more disaggregated indicators, and it will also improve the reporting in terms of not only looking at the number of girls, but also looking at the product distribution and the location. We are also planning to utilize geomapping systems to be able to see where there are gaps within the distribution. We do plan to develop the research and evaluation agenda, where we will then be able to measure what are some of the outcomes and what is the impacts as well in terms of this large-scale intervention. We are also planning to utilize digital systems, as I did indicate in the presentation. We, as National DSD, we are responsible for the design and implementation of the National Integrated Social Protection Information System. So we will be utilizing the system to give us a bit more aggregated data and information in terms of the rollout. Thanks.
Thank you very much. Can we ask Unola Limfengu to provide the answers, especially for the NPO funding issues, that the questions that related to national?
Thank you, DG, and good afternoon once more. I will try and cover the questions that were related to the funding of NPOs. I think the first comments, they were from the Human Rights Commission in terms of the funding issues that were related to NPOs, and also with Gauteng and also Free State NPOs, whereby it has been mentioned that there has been an outright cancellation of contracts due to non-compliance with the administration. I think Gauteng, since they're here, I think that they should also be able, to provide, some guidance in terms of this issue. But in terms of Free State, I think it would have maybe been easier if, one had some kind of a context. However, we will follow up with that province to get, some of the reasons as to why, there is such a report. And then in terms of the policy, I think policy complaints regarding the, non-involvement of the Human Rights Commission in terms of the M&E. Yes, our policy, it does not specifically, highlight the Human Rights Commission in that aspect. But however, I think, from the different provinces, I think a Human Rights Commission is welcome, to, be extended an invitation when they are doing those monitoring visits. And then in terms of the issues with regards to the salaries of social workers in the NPOs, I think the issue of staff salaries, it's the most significant driver. It's a cost driver, with regards to NPOs that are delivering services. And it's not really a straightforward issue, as the NPOs, they are operating or they are established differently from, the government. And because, there are those fundamental reasons on why the NPOs are formed. However, we are in the process of doing a survey in the major social sectors amongst, statistically significant sample of NPOs, whereby we will be conducting the study to collect the data on staff salary costs. And I think that that survey, it will assist us in terms of determining the average salaries of different staff categories, the variability across provinces, whether it's urban and rural, and to also determine some of the staff salary norms for various social sectors within social development. And then I think there was also another question which relates to, the delays in the funding of NPOs. Perhaps maybe if I can just indicate that if one were to look historically in the funding of NPOs, if you look at maybe 10 years ago or 5 years ago, there has been, a significant, improvement or progress in terms of the funding of organizations. Yes, there will be those instances, where there are delays here and there in certain provinces. But however, I think if one were to look at the, previous financial years where there were serious challenges, that were, that were highlighted. And as the DG has already indicated, we have reviewed, the policy that we had in terms of funding of organizations. And with that policy, it is embedded on the issues of transparency in terms of fairness, in terms of timely payment of the NPO. So that's why I'm saying, there has been quite an, a progress. And obviously, some of the challenges, as we go along, we are able to deal with them because it cannot be, something that can be done overnight. However, with the current funding of the NPOs, to be sitting at that, state, it means there is some improvement. And as we have indicated, in other instances, it's either, from the province side, and in other instances, it is from, the NPOs themselves, because other NPOs, as they are, provided with funding, sometimes they don't want, to comply with the funding requirements, with the monitoring aspects and all of that. But those are issues that we continue to try and address as we also monitor the provinces from our side. And then another issue, it was the budget cuts, which I think, those are the issues that we, as social development, we're not the only, government department that is affected by the budget cuts, because usually, it will be a directive that is coming from the National Treasury, whereby, the budget will be cut, at a specific a percentage and all of that. But what I need to highlight is that we have been working with the, in collaboration with the National Treasury, even with regards to, we have been working with the National Treasury, in terms of the development of this policy. And we're also, in continuous engagement with them, because we would like to explore whether, it is possible to ring fence, the NPO transfers, because what we have noticed is that during the budget cuts, you find that, the provinces, will cut some of the budget that goes to the NPO. So those are the discussions that are still open between the department and the National Treasury in terms of those issues. And then I think on the issue of the funding with regards to Gauteng, one of the slides was indicating what were the reasons for not signing off the contracts. I think Gauteng will address that. However, from our side, our understanding is that it's because those NPOs were not in agreement with some of the provisions that were on the contracts that they were supposed to fund. Hence, they kind of, did not want to sign those contracts, and because of what has been happening in Gauteng over this the previous financial year. I hope I've covered most of the issues under NPO funding. Thank you.
Thank you very much. We will then request the last response from the presentation on GBV from Suwesiso. Over to you, Suwesiso.
Thank you, DG, and honorable members and chairperson and colleagues. It's very brief on my side. The question on the involvement of DSD1 Pillar 2, which is prevention and rebuilding of social cohesion. I just want to highlight that, yes, we have noted the importance of us participating at schools level, but I must say that from national side, we are actually implementing what we call integrated prevention program to curb social ills amongst children and youth. And this is a program that we run on a almost monthly basis at institutions of higher learning, but we're also targeting mainly TVET colleges, where you also find the under 18s. And when we go to those institutions, we are integrated in the sense that we talk about issues of GPV, we talk about social crime, then we talk about anti-substance and drug abuse as one of our key things that we engage young people on. And it's a program that we've been running now. This is the 5th year that we've been running it as national DSD, but actually even longer than that. In the previous financial year, we actually reached about 30,000 young people from TVET colleges. Then there was a question around, and I also know that provinces would have programs that they are running at schools on the same. LGBTI, in terms of shelters, we as a department, we've got a policy, it's called the Intersectoral Policy on Sheltering Services. And within that policy, we're very clear on our admission criteria, but we've also gone on to a monitoring drive, if I can call it, whereby we actually do monitoring in the 9 provinces. The focus at this moment has been in hotspot areas, but one of the things that we are looking at is how accessible our services to LGBTI persons, but also to older persons and persons with disabilities. So there isn't discrimination of LGBTI persons, even when you look at the policy itself, the way it's crafted. But we take into cognizant of the challenges that might be there, especially when you deal with trans persons. Lastly, it's to talk to the issue of, in fact, it was a comment from Honorable Kanyile to say drugs and substance abuse presentation, or the presentation to cover that in future. Yeah. So we've noted that we'll be able to do so. DG, thank you.
Thanks very much, Honorable Chairperson. Can I hand over to you in view of time? Should you have anything that we will be able to come back and respond? Thank you very much. Over to you, Chairperson.
Thank you so much, DG. Before we move on, I did ask a question. You did respond to the Baby Savers matter, and I think that is a positive response that you are looking into it. But I did ask whether you can provide us with the current number of social workers that have been trained by the state that are currently still unemployed and sitting at home, whether you've got updated data in that regard. Before we go.
Okay, thanks very much. We were sitting, I don't have the number now, but I'll be able to give you before we leave. We were above 3,000 something, because in KwaZulu-Natal, there were a lot of those that they were trained, they on scholarship that are not funded, but I will provide to you before we close. While provinces are, I will get the data on that. We are really strained on that area because we developed a strategy and we requested money from National Treasury. We didn't get much, but we also went into the private sector and look at other government departments, correctional services, education, and we proposed that each school must have a social worker so that we can get those employed. We are winning, but it's coming slow, and we hope that I think we will be able to turn the corner when as we move on and make sure that those that we train are really absorbed into the system. We need as many as social workers in the country in different areas, but I think we hope that we'll be able to deal with that. But currently, we still have that challenge that we have over 3,000 social workers that are not absorbed into the system. Thank you very much.
Thank you so much, DG. We will now hand over to the Eastern Cape, followed by Gauteng, Mpumalanga, and the Western Cape. Our meeting is scheduled to finish at 2 o'clock. So I just want to say that after this round of answers, I will ask the National Shelter Movement as well as Ms. Lisa Vetten just to give an impression and inputs before we close at 2 o'clock. So they should also be ready. But let's hand over to the Eastern Cape, please, to the MEC or the head of department.
Thank you, Chairperson and honorable members. Good afternoon to you all. As Eastern Cape, we highly appreciate the questions and comments made by the honorable members. I think the National has tried to answer most of our questions, but let me zoom to the question of as social development board, it's our mandate. We were in touch with the family. In fact, it's not even family in that particular area. There were two private schools that were involved in this. 2 kids in one school, 1 kid in one school. Unfortunately, the other school, there's no noise about it. But one was 6 years, was raped. One is the boy child, 6 years. One is a girl child, 7 years. Both were raped in a private school, same at Atiel. And this one of Twekwe. As social development in the province, immediately cases referred to us by Tutuzela Center or hospital. Our social workers are on the ground, working with those families, working with kids, giving them psychosocial support for healing and also for being able to stand the trials if come to a push that there are cases. So the issue that we're not allowed to in the total family, I was there personally. to the home of Kwekwe. We've seen the child, we've seen the other two kids. Kids are coming okay, but the issue is issue of justice system, which is not our party. But we're trying with our premier all the necessary things to make sure that the perpetrators are found guilty. The two in other school, one already was jailed, one is waiting for DNA results. The Kwekwe case is the one that is having a principal was giving problems. But the cases, according to APA, they are promising that cases are going on. But abantu wanabona, it's on and off. Was the issue of rape? How I wish men can understand how traumatic it is. Well, it's a life. No, it's worse for a child. So, but social workers are doing their wonderful job in trying to heal them. Even as a province, we offered the family with the child to take her to Grahamstown for another advanced psychosocial support services. So we are working with the family, especially our premier, because we didn't want everyone to be touching them since there were some problems. So the premier and myself were in contact with the family, and the family is happy with that. But because of we're dealing with minors, confidentiality is paramount to us. We don't expose kids. Hence, you will never hear about us. We're doing our job quietly and professionally. With the issue of the list of children from that we are supplying, as a Department of Social Development, we get the list of kids from Department of Education, and social workers do their part of assessing each and every child in those lists. But I will hand over to, and we've delivered to all the districts, rural or not rural. If you are in that list, school is being given its delivery, and it's a year delivery, not a 1 month, because we know if you are a poor, you're not going to be poor for a month. If you are poor, you are poor. So our delivery for Sanitary Dignity is for a year for each and every child who is assessed and in the list from the Department of Education. But I will hand over to HOD. Let me raise also the issue of social workers. DG has touched it, but it is a problem for us as Eastern Cape, for the number of social workers that got their decrease because of us as government. We given them bursaries. Unfortunately, due to financial constraints, we are unable to absorb all of them. And due to high rate of gender-based violence in our province, it's my sleepless night problem that all these social workers must all be absorbed. And it's not even only those that are given bursary by us. There are even those that manage to get finance on their own. Maybe parents that has afforded to take them to school, but all of them, they're unemployed. So with the help of national and the help of other departments, they are taking small and small, but with what we are pushing now, if education, hence is them, most of the kids are being picked by educators. We are crossing fingers that if each and every school could have a social work, at least if that can happen, all our social workers that are unemployed will be in. But unfortunately, due to budget constraint, still that is not possible. But they're trying to take it a little. But this issue of gender-based violence, it cuts across all departments. Police should have social workers. Justice should have, suppose even justice system in the province, when there are cases of children, they are assisted by us to get specialized social workers who could assist children to be in courts and are trained to deal with their serious, because issue of rape and gender-based violence is quite critical. It needs a well-trained social worker. They're not all trained in that particular field of accompanying kids to courts, but we have that cohort in Nelson Mandela of social workers that are helping the even justice system for that. But it's our cry that we get all our social workers being absorbed in the system. Unfortunately, the budget, it is really cutting us off. And some of them are crying tears. They phoned that, Mama, I'm 10 years not working, I'm 15 years not working. But unfortunately, it's beyond our control. Even in my policy speech, I am forcing that each and every year I take 200. But there's no budget for that. But HOD had to scramble where and where so that all that 200 is employed. But that 200 is a drop in the ocean in the number. We do have total numbers. HOD will get in the total numbers that are still unemployed in our province. I will hand over to HOD to take over. Thank you.
Thank you very much, MEC. Thank you very much, Chairperson. I will just deal with the areas that have not been dealt with. There's 1,100 unemployed social workers on our record at the moment, Chairperson. On the question of which schools, which areas to provide details, Chairperson, through the National Department, we will then provide the list of the schools, the number of beneficiaries and the areas, Chairperson. The report will demonstrate that in any event, the Eastern Cape is largely a rural province. And so the allocations will go in the main towards OR Tambo, 25,000, Alfred's or 20,000, come to Amatole, come to Krisani, Jogabi. Your Nelson Mandela, BCM and Sarah Parman will have less because they have less of quintiles 1 to 3 compared to the other provinces. But through the Department of National Department of Social Development, we will provide the detailed report, Chairperson. On the formula of distribution, the department has a procurement plan. One of the clauses of that procurement plan deals with preference points, and preference points, Chairperson, are looking at locality, are looking at women, are looking at youth, are looking at people with disabilities. And so the formula ultimately, whilst price will trump everything else, preference points would have been dealt with through the relevant mechanism in the procurement policy. We have acknowledged, Chairperson, that the lack of service providers of people with disabilities is glaring. And in this regard, on the 17th of April, we had a session with the Disability Forum to engage, to get proposals on how to make sure that companies of people with disabilities indeed benefit from this big project. Just to round off on this reach, Chairperson, the Department of Education gives us the list of kids from quintiles 1, 2, and 3, and from farm schools and special schools. And what we had been doing as Department of Social Development is to use the SRD formula. My colleague had indicated that the SRD formula then is strict, far stricter, and it looks at social relief of distress, and therefore, and because the budget is not enough, we will then zoom to those beneficiaries that meet the standard. We are considering, Chairperson, relaxing that and using the standard of quintiles to receive from the Department of Education, because the assessment of the schools has been done. That is why they've been tagged quintiles 1, 2, and 3. And that is what we're considering doing moving forward, Chairperson. And in order to deal with some of the procurement challenges we've experienced, we're moving towards a three-year program to ensure certainty and uniformity and stability in our procurement. In addition to revising the allocation formula, because what we have been doing to date, Chairperson, is to use the price index. The price index will give us the average of 26 Rand. We will use that to calculate the target for the year. But then what we are beginning to experience now is that bids, the cost of bids comes lower than that 26 Rand consistently now 2-3 years. And so we will be changing towards a rate-based approach to invite service providers to bid on the basis of a rate and use that to calculate. And in that way, you are confident, Chairperson, that we will then be able to utilize all the funding. For example, in this year that has just ended, we have met the target and in fact exceeded the target. But as Honorable Zungula has pointed out, you still have a lot of money that is left. And that is why you are revising the allocation and the targeting approach to be rate-based in order for us to be able to fully utilize all the funds. And that is the plan to answer the question of Honorable Zungula. What is the plan fully to utilize the balance? The rate-based approach will enable us to use all the money. And how do you identify the beneficiaries? It is the Department of Education that provides us with the list of beneficiaries from the schools, and then we use the SRD test. But as I said, Chairperson will then provide the report. The MEC has explained that our cycle of distribution is once off for 12 months. The 1 month that was picked up was in relation to the contracting process with the service provider. But the distribution, each girl learner receives a pack for 12 months once off. That is the cycle that we use. Are these only Eastern Cape suppliers? Yes, they are only Eastern Cape suppliers. Are they manufacturers? Not all of them are manufacturers. In fact, there are very few manufacturers in the Eastern Cape. Only one manufacturer, which was based in the Eastern Cape, were able to utilize Chairperson. And so the manufacturers largely will be from Cape Town, Durban, Johannesburg, in addition to this one. And yes, Chairperson, not all of them are solely sanitary dignity based. They are general dealers. And we note the concern that has been raised by honorable members. Why don't you consider having a mechanism that prefers service providers that work with sanitary only? The issue is noted with the National Department and the Department of Women. I'm sure we will consider that a Chairperson. Without going into dealing with names of service providers that have capacity, in as much as we would know that a particular service provider has this or that capacity, the SCM process, the SCM rules will then dictate who comes out as a winning bidder. Chairperson, thank you very much.
Thank you very much. Can I hand over to Gauteng, please, to MEC Masipa?
Person of the Portfolio Committee on Women, Youth and People with Disabilities. Some of us were not used to sitting in meetings the whole day. This time we are out in the streets working. And I'm looking at my time. It means most of the work that I was supposed to have done. So we MECs, in other words, Honorable Chair, it's only the officials that are used to sitting in the office. On the issue of sanitary packs, Chair, as Gauteng, like Eastern Cape, it is the Department of Education that identifies schools. We don't identify schools. Just like General Smarts has been left out, it's a quintile 5. So if department did not submit it in their list of schools that need a dignity pack. In fact, now what we supply, Chairperson, is a dignity pack. It's not necessarily only pads only. And we also give to boys. In the dignity pack, there is roll-on, there's toothpaste, there's Vaseline, there's roll-on, and those sanitary pads. And we supply them once a month. Why we supply them once a month? We avoid giving them for 3 months, less other people also requesting those young people to say, pads. You know how households are. Pads. So the service provider is the one that has got the storage facility, and it does go to the school every month to go and distribute. So that's the arrangement that we have. On the distribution, when it comes to farm schools, Chair, it is there in the presentation. We do indicate that a total of 60 farm schools, we supplied them in the financial year of 2024-2025, and a total of 146 special schools that we did supply them. Our target was 1,521,702 sanitary packs that we actually distributed. And the schools that have been identified, there are almost 1,320 here in Gauteng. What we provide is what we call your Banapili also, Chair, so that then we not only intervene through dignity packs, but there's issue of school uniform and providing school nutrition, which is Department of Education, and through the CNTC that are in our communities that also link up to those children that are there. Through the child, we go through a household through a child, if I have to use that English word. We enter a household through a child, so that then even social workers make follow up. The food, are they getting SAHRC grants? What is happening in that household? So we not only end up at school, but we also touch base with them when they're in the communities. On the issue of NPOs, Honorable Chair and the members, there's a new boss in town called MEC Vetten. So all these bad relationship, not having good relationship, it's the story of the past in the 6th administration. We are now in the 7th administration, and we're working well with them. In fact, we even put timelines for them. So if you happen to miss a timeline, that's your story. We open the advert for funding on the 3rd of October, and we close it on the 30th of October. If you did not submit on time, Zulus, they usually say, walala wasala. You may know better, Chairperson. Walala wasala. You have the whole month to prepare documents and submit. You want to come at the last minute when it is closing day at 3 o'clock and you arrive at 3:30. You will find our gates locked. You won't be able to get in. And Honorable Chair, National must also tell you, they've deregistered 6,000 NPOs. Some of the NPOs got affected by that. That is why we could not fund them. I'm sure it also relates to your question on saying how many of these GPV shelters or NPOs we could not fund. Some of them, they were then deregistered. Of course, many other issues that then fall within your compliance issues. Like in our presentation, we indicated that we're busy engaging municipalities, because if you are a shelter and you are keeping people, you have to comply with the bylaws and comply with the health certificate. You have to comply with zoning. We have to comply with many things that are there. And even the houses that were given by Department of Public Works recently, my apologies, about 5 houses that we got from them. They had, not all of them are renovated, just like Eastern Cape is mentioning. But we have to identify our own budget in order to sort out those houses. For you to wait for national, you will wait .pitcom, and it will never happen, and it will take long. But they've given us power of attorney. Once we have the power of attorney, then we're able to sort out many of these issues. On the issue of the service providers, of course, as MECs, that's not our responsibility. It's through the tender process. We may not know who has been given a tender, who has not actually been given a tender in relation to that. There was a concern that was raised by Honorable Member Kanyile on the telenovela on Moja Love. That is part of, his name is Siakela. You are right, it's not educational, but the Film and Publication Board is the one that is supposed to take up that matter, because all the feelings go through them. For them to approve them, they must check for violence, whether under 13 and all those things, and be able to properly classify them so that then they don't find themselves in all those things. So in short, Chairperson, all those NPOs that suffered a problem, that was during 6th administration, we've been working with them in trying to sort out their issues. We've pushed many payments. For some of them, were not even compliant, but we had to assist them because majority of them also were new. They're not necessarily NPOs that were old in the system. Those that were old in the system, they had expanded their programs. So you find once you expand the program, then are classified as new. Then we had to look at that. But in all, Chairperson, those that are still outstanding, maybe it's about 3, if not 4. But with the new financial year they've applied, some of them have been approved. And as you will know, for the whole of last week, they were all signing SLAs. Only today that we're dealing with those that are dealing with substance abuse. So in all, Chair, bad relations with NPOs, I will say they no longer exist, not under our 7th administration, previously in the 6th administration. And it is a story that is now history. We've closed that chapter. We're now focusing on doing our work and ensuring that everything gets on track. Thank you very much, Chair. We appreciate this Gauteng to have been given an opportunity. Thank you.
Baie dankie, MEC, and sorry for keeping you in a long parliamentary meeting, but I think the work that we are doing today is very important. And also it was important to give you that space to tell us that those issues with NGOs and NPOs are something that is in the past. So now we will allow you to go to the ground and do further work, but thank you for your time and for being with us here this afternoon and this morning. Let me also then hand over to Mpumalanga and the Western Cape before I ask.
Thank you very much, Chair. Is Mpumalanga.
Thank you, MEC.
Thank you, Chair. Firstly, let me appreciate the questions and the comments that are made by members of this portfolio, Chair, and for giving us an opportunity perhaps to respond to. Let me start with the one of the Sanitary Dignity Program. Chair, from the question that was asked by the honorable member, yes, in our presentation, we did provide, Chair, the specific numbers in terms of the schools that we are supporting and the beneficiaries, even the grades, the total number in each and every district. But Chair, what we are going to do is to do, as she requested, that we resubmit in writing so that we are clear on this particular one. So we'll do that, Chair. I think it's on slide 12 from the responses that we have provided, on slide 12 and slide 9 to 10. Then, Chair, another question, I think it was on the why we did not distribute on the 4th quarter. Chair, we want to clarify this, that we already reached the target on the 3rd quarter because this is happening once annually. So when we distribute in a pack that will last up to for 6 months because of the budgetary constraints. We couldn't afford to do the packs that will last for the 12 months as per the 2020, as per the academic year. So these ones were distributed in 2024 academic year, meaning that for us it is 2024-2025 financial year, but the target was reached on that 3rd quarter. The total number that we have distributed on this quarter, it was 98,998. And then, Chair, also, let me check here, what are other questions? Okay, on what has raised by the member that there is a couple in Ligwa that is housing people and they will need us to assist the department. We are committing that we will come closer to that because for the fact that there is a house that is operating without our assessment, because when she says it's not registered, meaning that we did not come as Department of Social Development to do the assessment and to acquire or give them the opportunity to register that NPO. So we'll come closer to that so that we are able to give that assistance urgently. So because that there are people that are already staying there, it is a red flag. If anything should happen there, we will be in trouble. So I will request after this meeting to be given that opportunity so that I attend to that matter. And then on the issues of the tendering processes, Chair, I wouldn't want to go to, I thought perhaps the officials from the department will assist on that. But for the sake of time, from the information that I was given, Chair, it was the tender was closed on, let me check here from the information that I got. Okay, the first advert was issued in July 2024, and the closing date was on the 14th of August 2024. And the bids were received, but they did not meet the requirements. That is the reason why it was re-advertised. So now the process has been closed, and then is unfolding, and then which will lapse on the 30th of June 2025. I think that was it for Mpumalanga. And Chair, on the number of social workers that were trained by the department, yes, we do have a shortage of 637 social workers and 183 of social work supervisors. We have 384 of unemployed social work graduates in the province. So indeed, we still have that gap that we must ensure that perhaps we get enough funding and we are able to recruit more, because social workers are needed everywhere. Even in our department, we're still short of social workers. So that is what we can perhaps respond on as the department. Not sure if I have covered everything, but I have noted the questions that were asked here. Thank you very much, Chair.
Thank you, MEC, and thank you also for staying with us for the duration of the meeting. We appreciate your time. Can I hand over to the Western Cape? From there, I want to hand over to Ms. Lisa Vetten and then to the shelter movement, National Shelter Movement, before we round up our discussions.
Thank you very much, Chairperson. It's the head of department here again. There was only one question specifically for the Western Cape that I identified, and that was the question about the Access Medical, whether that was the same provider that is operating in KwaZulu-Natal. We don't have information about the one that's in KZN, so we can't be, we're not able to confirm at this time whether it is the same one. What I can say though is that we do verify the BE status of bidders when we award the tenders. So that's a very strict legal requirement that we must ensure that if they are representing themselves as 100% women-owned, that they are indeed 100% women-owned. So whether or not it is the same company, then we would have to check that if we can get that info. So perhaps if the standing committee would like us to follow up, or national DST to follow up between the provinces, then we can check and see the company number to see if it is the same one or not, or whether they are two operating with separate ownership in the different provinces. But that was the only question that I can recall for the Western Cape. Thank you, Chair.
Thank you so much, HOD. Yes, if you can follow up, that would be appreciated, because the Access Medical that we engaged with in KwaZulu-Natal is definitely 100% male-owned. So just double check. Can I ask Ms. Elisa Vetten and the National Shelter Movement to give impressions? We will be inviting you for longer presentations, but at a later stage, but I will speak to that during my conclusion. Ms. Vetten? Oh, I don't see her.
Thank you. Thank you very much, MP van der Merwe. Can you hear me?
Yes, ma'am, I can.
Okay, I have just tried to share a presentation. It's just one slide that I would like to share with you. I think you can see it, because I think it's crucial to what we wanted to say. There was a longer presentation, but we do think it's important that you have a look at this, because there's been a lot of talk about the lack of budget and Treasury not giving enough budget. And I think it's incredibly important to highlight underspending. And I'm putting the slide up so that you can look at the extent of underspending in Gauteng. The almost 500 million that was returned to Treasury last year because unspent. And as at 31st of January 2025, the 360 million unspent. Now, this is just NGO funding. It's not any other funding. It's funding to NGOs that at the end of 31st January, they had not spent. Obviously, there have been 3 months. They may have had the opportunity to spend all 360 million. I'm not sure they did, but I would like people to just have a look at that. And you can also see how Gauteng's budget to the NPOs has declined over the last couple of years. So while you look at that, I want to quickly go to, since we only have a brief amount of time and can only talk about key issues, the question about service level agreements that has been raised in the some of the questions asked by members, and that has been touched on in some of the replies on by National Department of Social Development. I think it's incredibly important that National DSD looks at the question of SLAs. They did draft a guide TPA or transfer payment agreement that they recommended that provinces should use. Our concern in Gauteng is that there is this draft TPA that is recommended through policy. We also had Premier Panyaza Lesufi stating last year in the midst of the crisis that he wanted a technical task team formed in order to develop a joint SLA between the department and NGOs that people would be happy with. That discussion simply terminated in October and no joint SLA was ever agreed. So instead, what has happened, and I will give Gauteng some credit for this, is that they do appear to be the first province in the country that is pushing ahead and has already started giving organizations SLAs to sign. I will give them credit for that. But there are a couple of very serious concerns within that SLA which the department does not wish to engage with despite contact with them. The first is that they expect NGOs to provide a chauffeur service to them, not even a taxi service for which they would be paid, but a chauffeur service. So in the contracts that have been provided to NGOs, they are expected to agree that the department can come and ask them to come and drive them around. So if the NGO has a car, the department is entitled to come and ask them to drive them around the DSD officials to where they want to go. There is no offer to reimburse the costs of any organization's petrol or their time. The people who drive these cars are typically social workers and social auxiliary workers. So they are being expected to take a day, hours away from their clients and their other work in order to drive DSD officials away around wherever they need to go. This has already happened once, and the organization concerned has not even signed a contract yet with the SLA. So there is that clause, the use of their cars. The second serious concern is that organizations, and it's confusing because in some regions, the provinces, the department is asking the director of the organization to sign this. In other regions, they're asking the chairperson. But they're asking them to take full liability in their personal capacity for any breach, violation, and I can read out the full reference if you're interested, but to take personal responsibility for that, for any way in which the department may be unhappy with the usage of the funds or anything else. They are required to take liability in terms of their personal capacity. Organizations have said, no, we are very uncomfortable with that. And the department's response has been, you can like it or you can leave it. That is not negotiation, and I think it doesn't recognize what Premier Lesufi asked for last year, was to come up with an agreement that is in agreement with both. And where organizations signed a declaration, they've signed the SLA because they've been told you won't get payment, which seems to forget that contracts are negotiated. But nonetheless, they have now been told for those who attached a statement that they signed this under duress, that these SLAs will not be accepted, they will not be paid. So that is the situation in Gauteng, is that refusal to negotiate and the unilateral imposition of an SLA on organizations, despite what Premier Panyaza Lesufi said. There are also the introduction of new conditions after the call for business plans. So I'll take the example of children's organizations. At the time they submitted their business plans, they had to submit their Form 9s, which indicated their staff had been cleared against the National Register for Sex Offenders. That was at the end of October. It's now the beginning of April. They are now being told that once again, they must go and get certificates or Form 9s from the Department of Justice for all their staff, despite the fact that they submitted these in November. The Department of Justice has said it will take 6 weeks to 2 months to issue those certificates to them. So we are now in April. This means that organizations might only get, the children's organizations may only get payment in June. This should have been told to organizations months ago, not after the start of the new financial year, and not when they have already submitted their certificates back in November. So those are just, I think, some of the concerns since they came up. We have many other issues to share with you. I think that deal with municipal non-compliance, that deal with the question of funding transparency. It's extremely important that national DSD follows up to ensure that each and every provincial DSD puts on their website, as they're required to do on an annual basis, a list of each and every single NGO that they have funded in the province, as well as how much they've funded. And they're also required on a quarterly basis to also put up on their website transfers to NPOs. This is key for transparency. It's key to see what's going. It's key to see how public funding is being expended. So I am going to just stop there, given the limitations on time. But since the question has come up repeatedly, those are concerns around contracts in Gauteng. Thank you very much, MP van der Merwe.
Thank you so much, Ms. Vetten. Can I ask the National Shelter Movement? And my apologies that we've run out of time. We will definitely, when the Portfolio Committee deals specifically with the issue of gender-based violence in our program, our second term program, we will extend another invitation to both organizations, to yourself and the Shelter Movement.
Good afternoon, respected colleagues. My name is Anissa. I'm the National Coordinator of the National Shelter Movement of South Africa. I haven't been granted the ability to share my screen. I have presented I do have a presentation, unfortunately, due to time constraints. I don't know if I can still share, otherwise I can talk through it. Please advise.
I think if you can talk through it, that will be helpful. And then you, like I said, you will then have another opportunity to present to the committee when we invite you for a follow-up meeting. And thank you for
thank you, Lisa. Thank you, Lisa, also for bringing up some of the issues. I think one of my key things with the presentation is highlighting the importance of shelters for survivors. And I don't think that's been acknowledged enough in practice. So again, one of the key issues there, just to say that we have great policies and documentation is really, really wow. Unfortunately, that doesn't translate into practice when it comes to sheltering. So sheltering, I think there has to be that recognition that it's more than just accommodation, and that we try to provide survivors with survivor-centered services, comprehensive services that include elements of economic empowerment, legal, therapeutic, and all of that, but not to waste too much time. I think I needed to highlight that first. The NSMSA being an umbrella body for over 100 shelters all over South Africa, and also serves as a united voice against gender-based violence, I think puts it in a good position to be able to talk to this topic. So I'm going to skip on exactly what we do, but advocacy and lobbying is one of them. And in the last few months, we've had to, put out a lot of PR outputs around the funding issue, which in a lot of ways got unheard. But just to quickly go further, the presentation included both financial and non-financial impact of the funding crisis. And some of them included, if you look at the non-financial ones, we look at lack of standardization of shelter services across the country, unequal service delivery, partnership and communication between NGOs and government is lacking. The different departments don't work together because we're supposed to be multifaceted. Support on for municipal compliance is very, very low, and prioritization around housing is lacking. So the list goes on. But like I said, for purposes of this presentation and due to the time constraints, I'm going to skip a lot of things. I think one of the big concerns is the message that we're sending out even to survivors, to what extent do they have trust and confidence in services around sheltering, when a lot of the times either shelters reached points in Gauteng during the last year where shelters closed down or suspended services, we had to turn survivors away. And that was unacceptable because, again, it has long-term implications, let alone implications for staff. So like I said, there's a lot of things I can still cover. I haven't even touched on salaries for staff. I haven't looked at the lack of communication. I'm hoping that the recommendations will help a little bit. And I think from our side, we looked at increasing the funding to align with the needs of gender-based violence survivors, which at the moment is not. And I think Lisa quite clearly pointed that out. And then timeous facilitation of the SLAs, aside from the issues with the actual content of the SLAs. So timeous facilitation of the signing and payment and disbursement of funds have always been delayed. And so shelters find it difficult to operate and even make operational decisions in the process. We need improved and consistent communication with NPOs. And I think that also then lends to the absence of transparency and accountability around funding and the relationship and SLAs and I did mention there's an absence of standardization of services, and that needs to be aligned. Support and guidance for compliance requirements. So municipal compliance, NGOs are having to spend from their own pockets for compliance requirements, and still they don't have the funds to do that. And still sometimes compliance is not acquired, and therefore they still lose funding. Increase in minimum wages for shelter staff. Restoring trust and confidence between DSD and NPOs. And I think that's an important one for us because right now that's really absent. So yeah, I've had to just run through. There was obviously, like Lisa also said, there's a lot we can say. Also, a lot of the issues that were mainly faced by Gauteng, but we can see ripple effects. So just on a recent update, there's delays in Mpumalanga. Eastern Cape has some issues with funding. So yeah, there are delays in receiving funds. Thank you. I tried to rush that. I don't know if I still have time, I can go back and unpack some of the issues.
Thank you so much, Anissa. I think, Ms. Vetten, you forgot to introduce yourself, if I can just give you an opportunity. And thank you, Anissa, for that. We will be, as a portfolio committee, engaging specifically on some of these issues at the end of May. And we will extend an invitation for you to make that full presentation then. Ms. Vetten, if you are still on the platform.
Thank you, I really hope so.
We will, most certainly. Ms. Vetten?
Yes, just very briefly, I represent the Gauteng Care Crisis Committee, which is a voluntary association of some 112 NPOs in Gauteng who have come together in order to look at these questions of how do they deliver the best services possible with the funding that they need in order to be able to do that. Thank you.
Thank you so much. Can I ask whether any honourable members wanted to take that second bite that they spoke about earlier? I see the hand of Honourable Spies, and I also see the hand of MEC Mazibuko. Honourable Spies.
Thank you, Chairperson.
Honourable Zongula. So Honourable Spies, Honourable Zongula.
Thank you very much, Chairperson. I always put my video on, but can I just really switch it off at this point? Chair, I have noticed that many of my questions were not answered. In particular with regards to the Gauteng issue. It was brushed off as issues in the 6th Parliament. The matter of the fact is, Chair, there's things like consequence management, and I think my question was not malicious. My question was merely, what are we doing to prevent such incidents again recurring again in future? And what What are the mitigation strategies? That's what I wanted. But if officials do not want to answer those questions, which we have experienced in this committee sometimes, is there other platforms that one can deal with that, if that is the case? But it was blatantly ignored. So I will not ask my question again. I think it's very clear. I will send it in to the department if they still want to. I'll send it to the minister, but I need answers on those questions from the province. Secondly, my last question, there was a service provider. I think the concern was raised by the official. I can't recall the name of the exact name of the official, but I think it was in the social prevention, in the youth department, social crime prevention, youth. There was only one service provider that was awarded a tender of 11 million rand. The particular official mentioned that that is quite a concern because I believe, and correct me if I'm wrong, the service provider were not that experienced and they are working on it. I want to know what are the exact or detailed actions that are taken to remedy that situation, because it is quite concerning if you look at a potential only one service provider awarded 11 million rand, and yet there's already a concern raised by the officials, not even by us, about this. So I want to understand what is the strategy with that. I would stand there, Chair. I would not want to deal with any other further matters. And as you say, there will be other opportunities, but I needed to record my dissatisfaction with my questions not being responded to. Thank you very much.
Thank you, Honourable Speaker. And please, I think your approach is correct. If you can give those questions to me in writing, and then we will send it to the DG so that he can ensure that those responses are sent to us. Honourable Zungula, and then the last person to respond to some of the issues that have been raised will be the MEC Mazibuko. Honourable Zungula.
Thank you, Chair. I'll also be very brief. I also share the same sentiments with Honourable Spees on some of the questions. In my case, it's from the Eastern Cape, which were not adequately answered, but I will give to you in writing. One of them is with regards to the suppliers from the Eastern Cape. These suppliers from the Eastern, the questions was, are they all from the Eastern Cape? And the answer was yes. And I'm not really satisfied with that answer because I know for a fact it's not the case. So I would request those suppliers, if the Eastern Cape can provide documentation to the effect that proves that all of those suppliers are from the Eastern Cape, because they're utilizing public money. We do not want to see their bank statements or anything that is private. We just want the written confirmation from all of those suppliers based on the application documents that indeed they are from the Eastern Cape. The second issue, I think it is a missed opportunity to have one supplier contracted to supply in 3 districts, because that deprives other suppliers in the different districts the opportunity of participating in the program. And given the problem that I alluded to earlier of the economy and government contracts being in the hands of few people, I don't think we should accept that we can have one supplier supplying for the entire province, or one supplier supplying for 3 or 4 districts, because again, it does nothing when it comes to the goals of job creation and transforming the economy. The last issue, Chair, is that I want to reiterate that perhaps the department or all of the implementing agents nationally, the focus should be on utilizing suppliers that are specific on sanitary towels, not general dealers, because general dealers will never have the appetite to focus on this aspect of sanitary towels. Theirs is just to make money, even if it's buying and reselling. But if it's suppliers that are focused on sanitary towel productions, then the view or the objective would for them to ultimately manufacture their own sanitary towels instead of buying from other suppliers which are based in other countries and provinces. So what I want to emphasize, Chair, is that whilst there's a need or the drive to deliver services to the deserving girl learners, but we must be cognizant of the prevailing economic conditions, which necessitates that the decisions that are taken when it comes to the implementing part of it must be transformative in mind and must also utilize the local suppliers. And we must guard against any sidelining of any supplier, especially which are known to have a proven track record. They have connections and contracts with other countries to assist them to set up their own plants in the provinces, because that is what we want, to have more local Black, female-owned producers of sanitary towels in our country. Not only have a case whereby the sanitary towels that are used are manufactured outside of the country, they are just repackaged here in South Africa, and it ends there. Thank you, Chair.
Thank you so much, Honourable Zungula. We thank you for those inputs, and we align ourselves with those views that you just gave or inputs. And we give over to Ms. Masibuko, MEC Masibuko.
Thank you very much, Chair. I did not want to respond, but I was requesting that in your May meeting, can you include us as part of the right to respond? There were some allegations that were peddled here in the meeting. So I want to set the record straight. Thank you very much. That's all that I wanted to say.
Thank you so much, MEC. We will definitely allow you for that right to reply. Honourable members, firstly, those members who want to send written questions, you can send those to Mr. Mdumizweni and DG. We will then be sending those questions to you. And I hope, while MEC Mazibuko has mentioned it, but I hope you took note of the concerns with regards to the SLAs for NPOs and NGOs. And also, I think we need a report into the monies that were allocated to NGOs and NPOs that were not spent. And also, MEC Mazibuko alerted to this, but I think we would need to get a list of those NGOs and NPOs that have been deregistered, and and then obviously furnish us with the reasons as to why. I think it's clear, colleagues, with regard to the Sanitary Dignity Program, this program is not working optimally, and it's not reaching all of its intended beneficiaries. And I think the idea of a uniformed approach is more critical than ever. And I think we will also engage with the Minister of Women, Youth and Persons with Disabilities in this regard. We will, as a portfolio committee, keep a keen eye on the developments around the defunding of NGOs and NPOs, and in particular as it pertains to women, youth and persons with disabilities. And then with regard to the fight against gender-based violence, I think really for me, sitting here, knowing that government has trained so many social workers that are still sitting at home, social workers that we need at schools, that we need at police stations, that we need at hospitals to provide vital services. It's really disheartening to know that a cabinet resolution in 2018 that was passed that said that these social workers must be absorbed into the various government departments 7 years later has not been implemented. And also, I think a greater focus must be put on this, and we thank the MEC for Social Development in the Eastern Cape that has made the commitment that she has put a focus on this area, and that she's ensuring herself that some of those social workers in the province is being absorbed. I think as a portfolio committee, we have said before that we think that there is an urgent need for a full parliamentary inquiry, or at least a parliamentary or a committee hearing into gender-based violence and our shortcomings or failures in this regard, and also in particular as it pertains to the implementation of the National Strategic Plan. And we have got plans for this for later in the year. And again, then we will be inviting all the role players and stakeholders. I want to say thank you to everyone that participated today. I know it has been a long meeting. Thank you for your time. Thank you for honoring your invite. In particular, thank you to the Portfolio Committee on Social Development for being with us today. Thank you for the MECs. I know MEC Mazibuko made the point that she has been in a meeting for a long time today, but we really do thank you for your time. Thank you, DG. Thank you to all the colleagues. Thank you to just everyone that was on the platform this morning. And this will be a first engagement of many, hopefully, as we continue to do the work in serving women, youth, and persons with disabilities. Thank you, colleagues, and this meeting stands adjourned.
Thank you, Chair.
Thank you, Chair.
Thank you, Chair.
Thank you.
Thank you.
Long live the chair. Thank you very much, Chair. Long live the chair. Long live social development.
Long live Chair Masango. Bye.
Thank you,
Long
Chair.
live.
Bye.
Thank you to all the members.
Thank you, colleagues.
Siyabonga.